from uh, India, I think, Turkey, and Iran. So let's have a look at School of Persian Medicine, which is the host of this program, and let's see what's going on in this school.
School of Persian Medicine at Tehran University of Medical Sciences was established in 2007 as the first School of Persian Medicine at Tehran University of Medical Sciences was established in 2007 as the first faculty of Persian medicine in Iran. School of Persian Medicine is a center for educating the evidence-based science of traditional Persian medicine and has a modern clinic for patient services. School of Persian Medicine encompasses 3 departments, which are Traditional Medicine, Traditional Pharmacy, and History of Medicine. Each one has numerous students and graduates. As a School of Persian Medicine, we provide modern laboratory for production and quality assurance of traditional and herbal products. We also enjoy fully equipped library, study space, computer center, and multiple congress halls. At the School of Persian Medicine, medical services are provided through 2 clinics. Ahmadiyya and Khark. These 2 teaching clinics are not only affordable for the general public, but also create an opportunity for medical students to give health services under the supervision of faculty members. Both of these clinics have pharmacies which dispense natural products under the supervision of traditional pharmacy specialists. More than 500 scientific articles have been published with the affiliation of School of Persian Medicine. About 15% of these publications were carried out by international collaborations with experts from the United States, Australia, China, India, Brazil, and Pakistan. We have published numerous scientific books, both in Farsi and English. Elsevier, Springer, and Bentham are among the publishers. School of Persian Medicine has the unique capacity for international activities in different levels, from holding high-standard international conferences to long and short-term educational and research programs. It has also the capacity to accept full-time international students in all 3 departments. School of Persian Medicine has not forgotten technology. We support highly creative technology projects in Technology Incubator for traditional medicine, pharmacy, and natural products. Traditional and integrative medicine is our peer-reviewed Scopus Index journal, which publishes high-quality scientific articles on traditional, complementary, and integrative medicine. Traditional Persian Medicine and Complementary Medicine Student Association is a recently established scientific association that has held diverse scientific workshops, webinars, and journal clubs. We are awaiting all the students around the globe to join us in this association. School of Persian Medicine, a path from ancient treasure to the future of science.
Okay, so we're all inviting all the online guests to pay a visit at Tehran and visit us. A place we can have researches and different scientific webinars together. So for the start, I want to invite Dr. Rudabe Bahram Sultani, who is the chief organizer of this conference, to have her valuable speech.
In the name of God, the compassionate, the merciful. Hello, everyone. Good day to you all, wherever of the world you are in. I hope you have a nice day till now, and thank you all for joining us today. As the Vice Dean of International Affairs at the School of Persian Medicine, Tehran University of Medical Sciences, I am honored to announce the official beginning of the first International Symposium on Materia Medica. We have launched this online series as a seasonal program, and each season we aim to put the focus on a specific medicinal plant, which is globally important. So as the first symposium and as the first plant, we decided to put a focus on saffron, Crocus sativus, a spice, a medicine, and a culinary material which is originated from Iran and is exported to different parts of the world. So it is a globally important medicinal plant. And today we are going to review different aspects of this plant from traditional medical doctrines, Persian medicine, Thai traditional medicine, Unani medicine, and some original researches regarding saffron, as well as some agricultural points on this medicinal plant. So I hope we have a fruitful symposium today. I'm sure with the honorable speakers, we are going to listen to their lectures. And as the first speaker, we were actually expected to be with Dr. Behjat Javadi from Mashhad University of Medical Sciences. She just called me that and said she has a problem with her internet connection. So I think we have to postpone her speech to one of the last speakers. So if I see the name of Dr. Ronida Bunrak. Dear Dr. Bunrak, if you're ready, I would be thankful if we can start with your lecture as the first speaker. Dr. Bunrak, Bachelor of Applied Traditional, Bachelor and Doctor of Applied Traditional Thai Medicine, instructor of Thai Traditional Pharmacy from the Center of Applied Thai Traditional Medicine, School of Medicine, Siraj Hospital, Maidul University from Thailand. It is our great pleasure to have you today in this symposium, dear Dr. Bunrak, and the platform is yours. Thank you very much.
Thank you very much. Okay, everyone see my slides?
Yes, we have your slides.
Okay, thank you. Good morning, everyone. I am Randida Bunrak from Thailand, Center of Applied Thai Traditional Medicine, Faculty of Medicine, Siraj Hospital, Mahidol University. It's been an honor to share Thai traditional medicine knowledge with you all. Today, I will talk about the use of saffron in Thai traditional medicine. The topics that I will say are about Thai traditional medicine knowledge, concept of herbal medicine in Thai traditional medicine practice, Thai traditional pharmacy principles, and saffron in Thai traditional medicine. First of all, Western doctors treat patients depends on sickness or symptoms in each human system. In the past, the Western doctor learned about each human body system through cadaver dissection, which is much different from Asian medicine. The Asian doctor uses an observation technique and comparison to the ecosystem in nature to the human body system instead. That's why Asian medicine focuses more on balancing the 4 elements inside our body, unlike Western medicine, which focuses on symptoms from each body system separately. So I will demonstrate the blood vessel compare with the 4 elements for briefly understanding. The first one, earth element, is a touchability element, so you can sense its roughness and hardness. Then the earth element functions as the habitat of other elements like an organ in human body. And now it is demonstrated as blood vessel. And after that, water element is a liquidity, infiltration, and absorbability element. That is why it can be a binder and moisturizer in the organs. Now it is demonstrated at blood in the vessel. Next one, wind element is an untouchable, movable, regulate, and circulate element, but you may sense it like breathing in the airway or gas in the stomach, or you even might not sense it like the circulation in the body as in the blood vessel. And lastly, the fire element is also an untouchable element, but it functions to energize, warm, and burn other elements like the body heat energy system. So, the causes of illness in Thai traditional medicine theory composed of 2 factors, internal factors and external factors. Internal factors mostly are affected by body elements imbalance, such as defective body elements, and or even age changes. Moreover, season changing, time changing, different geography, or improper behaviors are one of the external factors. For the practice guideline in Thai traditional medicine, we separate into 2 guidelines, which are herbal medicine and non-herbal medicine. For herbal medicine treatment, we treat the patients with a single herbs or formula recipe, which references from the Thai National Drug List or individual decoction formula. For non-herbal medicine treatment, we have maneuvers, treatments such as massage, hot herbal compression, and also giving thalidomide advice. Then the concept of herbal medicine in Thai traditional medicine nowadays still used, followed by Thai traditional medicine knowledge, which considered the balancing of element together with Thai traditional pharmacy principles, such as 9 medicinal tastes related to pharmacological effects. And also using scientific evidence to understand mechanism of the traditional medicine, likewise reverse pharmacology. Then we integrate all the data analysis to translational practice, which is called evidence-based medicine. Concerning Thai traditional pharmacy principles, we not only considered 9 medicinal tastes, we also analyzed the structure of herbal medicine recipe, which consists of the main ingredients, the secondary ingredients, the controlling ingredients, and the seasoning ingredients too. Besides, the 4 principles of Thai pharmacy play important roles in Thai herbal medicine production as well. Saffron in Thai traditional medicine. Saffron was used in remedies from ancient times, but it was not used as the main ingredient because saffron is not a local plant. So we had to import expensive ingredients from India, Iran, and Spain. Mostly, saffron is used in incense or used as a tonic, such as blood nourishing and pharyngitis in children. The example of saffron and the 4 elements in elderly people. Start with, when people are getting old, the wind element will rise up here, affect the water element and fire element, and it can cause loss of appetite and fatigue. Then the water element and fire element also influence back to the wind element, which can cause muscle pain and flatulence, and especially dizziness and fainting. After 3 elements are unbalanced, the earth element, which is habitat of organs, then finally become unbalanced too, which can cause muscle tenderness, joint stiffness, or constipation as well. In medicinal tastes, saffron is determined as a fragrant taste and is used as a tonic for the heart, lung, and liver. And also can relieve dizziness, fainting, headache, and thirst. So we prescribe fragrant taste in the remedy for decreasing fire element and balancing the rest of them. In Thai scripture, we found only 7 remedies that contain saffron here, and saffron is categorized to be the secondary ingredients or seasoning ingredients. The 7 remedies consist of one recipe for unbalancing wind element, 2 recipes for heart tonic, 2 recipes for pharyngitis in children, and 2 recipes for blood nourishing. These 7 recipes can be categorized by each proper as followed: pharyngitis in children, unbalancing wind element, which can affect the gastrointestinal system, the heart tonic, which can affect the circulation in the cardiac system, and blood nourishing can affect the menstrual system. As I mentioned before, we use scientific evidence, or we could say evidence-based medicine, to understand the mechanism of traditional medicine. We classify the type of evidence into the level of evidence and also categorize the grade of recommendation by the meaning of clinical practice guidelines. In this case, we found that saffron was investigated in many fields related to Thai traditional medicine properties, which were used as well. So the summary of the use of saffron in Thai traditional medicine are: in Thai traditional medicine theory, If the four elements are imbalanced, it can cause illness. The holistic care includes herbal medicine, massage, and thermonomy. Saffron has been used for a long time, but very expensive and imported ingredient. Saffron is used as a tonic like blood nourishing and pharyngitis in children, and is also usually used as a secondary or seasoning ingredient. Properties related to evidence-based medicine. Lastly, Thai traditional medicine is not massage. Thai traditional medicine is not herb. Thai traditional medicine is the art of treating, enhancing, preventing, and rehabilitating health with Thai wisdom, Thai culture, and Thai way of life. Thank you very much. So, have any question?
Hello?
Yes.
Yes. Thank you very much, Dr. Bunrak, for your nice presentation. It was really interesting and informative, especially your last slide on the general aspects of Thai traditional medicine. It is not just manual therapy. It is not just medicinal plants. It is exactly the same as Persian medicine. So these two complementary medical doctrines have close relationships, I think. And I was wondering, just for my personal information, how much saffron is used in Thai culinary? Because in Iranian foods, Iranian dishes, a lot of people use saffron in their foods. I was wondering if it is like this in Thailand, or it is not that popular.
I could say that it's quite popular in the food that we receive the culture from Arab, but in Thai traditional medicine, or usually we don't use it, because in Thailand saffron is very expensive. Like 1 kilograms about 6,000 baht, like that. So it's quite an expensive ingredient. Yes.
Thank you very much. It is actually, I think, the most expensive spice all over the world, not just in Thailand. Maybe the lowest price might be available in Iran because we produce it, but even in Iran, it is a very expensive medicinal plant. So thank you very much, and thank you for joining us today.
Thank you very much.
There is one question from Dr. Paknejad. Dr. Bunrak, if you kindly please answer. She asked how you use saffron for pharyngitis in Thai traditional medicine.
Follow as Thai scripture. When we use for pharyngitis, we use in just one ingredient in the recipe. For example, that recipe has about 20 ingredients. Saffron is one of it. And like I said, we analyzed that saffron might be a secondary ingredients or seasoning ingredients in that.
Thank you very much. So it is used as one of the ingredients in a multi-component product, yes?
Yes.
Thank you very much.
Thank you.
So fortunately, the internet connection of dear Dr. Javadi is now okay. So as the second speaker, I would like to invite Dr. Behjat Javadi, PharmD, PhD and Assistant Professor of Traditional Pharmacy from Mashhad University of Medical Sciences. Mashhad is in eastern part of Iran and is one of the cities located in the area which is actually the main producer of saffron, not only in Iran, but also around the globe. So I know that Dr. Javadi had many researchers about saffron, And now today she kindly joined us to talk about traditional uses of saffron in Persian medicine. So dear Dr. Javadi, welcome, and the platform is yours. Thank you.
Thank you, Dr. Bahram Sultani. Hello, everyone. Do you have my voice?
Yes, we have.
Do you have my voice?
Yes.
Or I use this? Okay. I would like to start my presentation with a story, and okay. When I was a child, maybe 7 or 8 years old, one day my father came to me and excitedly told me about an antique manuscript with many color, very precious color illustrations of medicinal plants. And he told me that he had come across this book, this valuable book, when he had worked voluntarily in one of the most authentic libraries of Iran many years ago. That was my first encounter ever with the subject of medicinal plants, traditional medicine, and handwritten manuscripts. And many years later, when I was studying pharmacy in Mashhad University of Medical Sciences, I had the opportunity to actually see, read, and research on this valuable book, some of these manuscripts, of course, their photos. And that was very exciting for me. As a someone that studied in the field of traditional medicine, there was when I found out the book that my father had told me about was an Arabic translation of the book Materia Medica or Al-Hashayesh, compiled by Dioscorides, the father of pharmacology, around 2000 years ago. And you can see some of the versions of this book. And it was so exciting for me. As someone from the Khorasan province, I also was always very proud of saffron. I was so curious. What scholars of Persian medicine have stated about medicinal uses of saffron. And also I was so modern pharmacological studies and clinical trials are a proof of these medical uses of saffron. So we conducted a survey to search the states, the uses of saffron in Persian in view of scholars of the great scholars of Persian medicine. In this slide, you can see some of the most important scientists of the Persian medicine that have commented on the uses of saffron. You can see the book Ferdos al-Hikmah from Tabari, Al-Hawi from Muhammad ibn Zakaria Razi, Hidayat al-Muta'allimin from Bukhari, the book Al-Abniyah from Abu Mansur Muwaffaq and of course Al-Qanun from Ibn Sina, Zakhire Kharazmi from Sayyid Ismail Jurjani, and Mahsan al-Adwiyah from Muhammad Hussein Abidi Khorasani, and so many other scholars exist actually. One of the most important aspects of medicinal uses of saffron is its gastrointestinal protective effects. In many Persian books, Persian medical books, it is stated that saffron can improve gastritis, it can improve appetite, it has antiemetic effects, especially in topical use. It can be an effective anti-hemorrhoids, and it can alleviate intestinal inflammations. For example, Razi had stated in his book Al-Hawi that saffron is a digestive drug with astringent properties. It cleanses the stomach. Another major use of saffron in Persian medicine is for its hepatoprotective effects. Tabari in Ferdos al-Hikmah stated that it is warm, moderate, and dry. It is a resolvent and bitter. Therefore, it can treat liver obstructions. So, in Persian medicine, we use saffron, especially in compound formulations, to improve many hepatic diseases, especially fatty liver. Another very important use of saffron in Persian medicine is its oxytocic properties. Saffron can facilitate difficult labors even after local use. For example, Razi in Al-Hawi had stated that ingestion of 6 or 7 grams of saffron can induce the labor. He also states that I myself prescribed it many times and the result. So saffron can be a good agent to facilitate difficult labors. Saffron also is used to treat urogenital disorders in the view of Persian medicine. It has diuretic effects. It has anti-urolithic activity. It also is used to treat urinary retention, and it is a potent stimulant of menstruation. It also is used for uterine problems such as intrauterine adhesions, inflammations, and even malignancies. Another important use of or effects of saffron is its accelerating properties. Saffron has been stated to have antidepressant effects. Even it can induce laughter in higher doses. Jurjani had stated that the effect of saffron in enlivening the essence of essence, the essence of esprit is great, and it can induce happiness. So in Persian medicine, saffron has always used to treat depressive patients and to induce happiness. Another important use of saffron in Persian medicine is in eye disorders. Some eye formulations called sorme or koh or coryllium, which are compound formulations to use in eye diseases, always have saffron as one of the important components. It is used to treat cataract, blepharitis, pterygium, loss of eyelashes, and also vision problems. Saffron is also used to treat respiratory diseases. It is used in compound formulations to treat asthma, shortness of breath, cough, and hemoptysis. For example, Giorgiani has stated that inhaling the smoke from burning a mixture of myrrh, crepe ginger, Chinese cinnamon, and saffron is used to treat asthma and shortness of breath. So saffron is one of the most important medications for the disease of respiratory system in Persian medicine. Cardioprotective effects of saffron is also very important, and many scholars of traditional medicine, Persian medicine, have stated this therapeutic effects. Saffron can support the cardiovascular function and improve palpitation. If we have a look in the modern pharmacological studies and clinical trials, we can say that the cardioprotective effects of saffron is effects on improving the components of metabolic syndrome, such as obesity, dyslipidemia, and hypertension, and other components. So saffron can influence the cardiovascular system disorders and in relationship to its effects against metabolic syndrome components. Saffron has one special effect that had been stated in many Persian medicine textbooks, and it is the absorption enhancing properties of saffron. It is stated that saffron has the ability to increase the bioavailability and the absorption of co-administered drugs. Can decrease the dosage of potent drugs with side effects, and the physician can prescribe lower doses, and it will be more potent with less undesirable effects. So this property is a good subject to be researched in modern pharmacological studies. Let's talk about toxicity and adverse events of saffron in view of Persian medicine scholars. Aqili Khorasani had stated that it can cause headache and its consumption with wine can result in intoxication. Long-term use of saffron can lead to dizziness and damage to the nervous system. Aniseed and oxymel can correct these adverse events. It has been stated that about 10 grams of saffron can be lethal. Also, in Canon, Ibn Sina has stated that intake of 10 grams of saffron is fatal due to the induction of extreme joy. Persian medicine, quality assessment of medicinal plants, especially saffron, is very important. Ibn Sina introduced high quality saffron as follows. Fresh saffron of high quality is characterized by nice color and fragrance. The upper parts of its stigma should be whitish in color. Saffron should not be moldy. It should be neither too compact and thick nor crumbly. Besides, it should not easily impart its color and touch. So that was my presentation. If anyone has questions, I'm here to answer. And thank you for your attention.
Thank you very much, dear Dr. Javadi. It was a really nice presentation about what saffron does in Persian medicine. So let's see if there's any question in the chat box. Some participants are asking for downloading the slides. Actually, I think the slides cannot be downloaded, but the whole symposium is recorded. So you can, if you want to check the lectures again, you can then go to the webpage of Symposium. I think from tomorrow the video would be available, and then you can view different lectures. Any of the lectures, you can view them again. So any questions? Dr. Mohsen Delvi has asked, what is the recommended dose of saffron? I think it depends on whether we expect to use it as a food ingredient or as a medicinal plant. But Dr. Javadi, would you please give some actually guidance in this regard? What is the routine recommended dose of saffron as medicine in medicine? He asked in medicine.
Yes, thanks. Saffron is usually used as a spice in very low doses. But if you want to use saffron as a medicinal plant, it should be around 4 or 5 grams a day from the raw saffron. Or its equivalent in extract.
Thank you very much. And there is another question about how to use saffron for eye diseases such as blepharitis or loss of eyelash. And another question, I think this question about eye diseases would be better answered if our
Yes.
dear participants wait for the next lecture by Dr. Haydari. And there's another question, if Safravi Mizaj person can use saffron according to Irani tip or Persian medicine, I think he is meaning. Whether Safravi Mizaj people can use saffron in Persian medicine?
Yes, they can actually use saffron, but in lower doses and with some medications, for example, secangibin or other anti-saffron medications. But it is important to use this in lower doses.
Thank you. I
Lower
think
than
generally
usual.
yeah, because it is a very expensive
Yes.
actually plant. No one is going to use it that high. That may cause a
Yes.
problem even in Safravi Mizaj people. So, and there's one more question. Would you please explain about some adverse effects of saffron, such as teratogenicity? You shortly mentioned in the last slide on toxicity, but would you please briefly repeat about some adverse effects of saffron?
Our adverse effects of saffron, as I said before, are dizziness and maybe some sort of headache and eye pain, but it is not very common in low doses, especially at doses that we use as a spice. So you should not be worried about these side effects normally in normal use of saffron. In the lethal doses of saffron or higher doses than, as I said before, 10 grams of day, it can be lethal. So other side effects of saffron in that are stated in some clinical trials that evaluated the use of saffron, for example, in dyslipidemia, in hypertension, in depressive disorders, have been stated, but I didn't notice that saffron could be teratogenic in none of these, in fact, studies, clinical studies. Maybe more studies in future can pave the way.
Thank you very much. Yes, one of the participants mentioned that it is forbidden in pregnancy. Of course, it has aminogogue properties, saffron, but again, the dose would be important and the background of the patient would be important, how much sensitive the patient is to the abortive effect of saffron. And,
yes, it is oxytocin. Yeah. We have mentioned that it has potent oxytocic effects. So it is obvious that in pregnancy it is forbidden. Yes.
And oxytocic actually plants and spices are forbidden during the pregnancy, but at the childbirth it would be helpful because again, because of the induction of muscle contractions, it would be helpful for giving birth to the child. So and one more question. Wow, many questions about saffron. Question is, what are its dermatological effects, especially when applied locally?
I didn't notice very powerful dermatological effects from saffron in Persian medicine. Of course, it can be used in modern pharmacological studies, but speaking on behalf of Persian medicine, so it is not mentioned. It is not mentioned in any Persian medicine textbook.
Well, thank you very much, Dr. Javadi. Your presentation was really interesting, as you saw, according to the comments. And okay, according to the timetable, we are honored to have our next speaker, Dr. Mojtaba Haydari, a medical doctor, PhD of Persian medicine, and also ophthalmology. So this is one of the actually most interesting speeches of today, because a specialist in both Persian medicine and ophthalmology is going to talk about the effect of saffron in eye diseases. So dear Dr. Haydari, hello, thank you for joining us today. And if your internet connection allows, we will be thankful if you can turn on your camera, but I know that it might affect the quality of connection. So we give it to you. If you can turn it on, it would be appreciated. But if not, if you think your internet connection does not support your camera, we'll be here to actually listen to your lecture. Thank you very much.
Good morning, all. Thank you for your invitation, and I am glad to be with you in this interesting conference about the saffron as a materia medica and as a medicinal plant that is used in different diseases. I want to focus in my lecture on the saffron in eye diseases. As you said, I have graduated from Persian medicine, PhD in Iran, and after that I continued my education in the ophthalmology, and now I have focused on the research in the field of Persian medicines in eye diseases. And now, according to the title of your conference, I want to talk about saffron in eye disease, focusing on traditional use, current knowledge, our knowledge, and future perspectives that can be worked in future. Do you have my voice? Is it okay?
Yes, we have your voice.
Okay. I turned off my video because I am with my mobile phone, and I need to see my PowerPoint here. Excuse me. I just have my voice and also my PowerPoint presentation. Okay, please, next slide. About traditional use of saffron in eye diseases, in Persian medicine, we have Persian medicine manuscripts have mentioned the use of saffron in different ophthalmic formulations, especially in different compound formulations for eye that is named in Persian medicine kohl. Kohl are ophthalmic formulations that was used topically in the eye, and in many of them, the traditional Persian medicine scholars have mentioned saffron as an important ingredient in these ophthalmic formulations and kohls. For example, in the kohls for conjunctivitis, that is mentioned in Persian medicine books, Ramat. Ramat is mostly compatible with the term of today term of conjunctivitis. For the disease of Kharab or dacrocystitis, inflammation of lacrimal sac, and also for tearing, it has been mentioned that it has been used for tearing that is namely pressure medicine DAM-A, or tearing of the eye, which is a symptom that mostly due to blepharitis and dry eye. It has been used for DAM-A, saffron, and also saffron for Zafare or Trigium. It is reported to be used in Persian medicine, and also night blindness or Asha. In this disease, the use of saffron in eye have been mentioned in traditional Persian medicine books. Please, next slide. But in the current studies, most of current studies have been focused on the use of saffron, and not as an ophthalmic formulation, but as a nutritional supplement in retinal disease. Please, next slide. Retinal disease like diabetic macular edema, like age-related macular degeneration, and also other retinal disease. These are the most prevalent indications for the use of saffron as a nutritional supplement in today's research. For example, in diabetic macular edema, I just have mentioned clinical studies in this part. For example, for diabetic macular edema, that is a complication of diabetes on the retina, and a study which have been done at 2018 in the design of our city randomized controlled trial. They have included 60 patients and followed them for 3 months, and they have used crocin, which is an important ingredient of saffron, between 5 to 15 milligram per day. And they have evaluated the vision of patient and also the central macular thickness, which can be calculated by imaging on the retina. And they showed that saffron supplementation, crocin supplementation, can improve both vision and anatomical features of retina. It means that central macular thickness was decreased with the crocin supplementation, which shows that crocin could decrease inflammation in the retina caused by diabetes. Please, next slide. Please, next slide. Can you? Thank you. But before diabetic maculopathy, the most prevalent indication for saffron supplementation in the today clinical trials was age-related macular degeneration. It is a retinal disease due to aging, and it has different forms, as you know, dry age-related macular degeneration and wet age-related macular degeneration. Wet is worse disease, and it causes blindness. The first studies, clinical studies on the effect of saffron on retinal disease, the first studies were done in Italy, and on age-related macular degeneration, which is known as AMD or age-related macular degeneration. Italians started to study clinical studies on the effect of saffron on this disease. Firstly, at 2010. They studied the effect of 20 milligram of saffron per day in a quasi-experimental study. I mean that they did not have used any control group. On 25 patients, they supplemented them with saffron and followed them for 3 months, and they measured electroretinogram response of the retina, and they showed that the saffron supplementation can improve in short term the electrical response of retina in these patients. The next slide. The next slide, please. The same team extended their study and added some other patients, reached the sample size to 29 patients and followed them for 14 months. And they showed that the same dose can have more longer effect. And beside the previous study that shows that saffron supplementation can have short-term 3 months effect on the electroretinogram and electrical response of retina in patients with AMD, they showed that the longer supplementation can improve the effect and improve both the electrical response of retina and vision of patients. But they did not use any control group in their studies. The next slide, please. Another study with other team, not the previous team, was done in Italy on the effect of saffron with the same dose, 20 milligram per day, and they also showed the same result and showed that saffron supplementation can improve the retinal electrical response of patients with AMD. Please, next slide. Uh, 4 years later in Iran, the first randomized clinical trial and control trial showed that saffron supplementation can improve both vision and the contrast sensitivity of patients with age-related macular degeneration, and also decrease the inflammation of retina and central macular thickness. And also they showed that saffron supplementation can improve the vision and contrast sensitivity, but the results showed that no effect was shown on the macular thickness and also quality of life patients. They showed that saffron supplementation in this patient can just improve vision and decrease the inflammation of retina. Please, next slide. Another study, clinical study on the effect of saffron supplementation on AMD was done by Australian physicians that they used crossover design for the first time in 2019, and they increased the sample size to 100 patients, and they followed their patients for 6 months to 3 months, 3 months with saffron and 3 months with placebo supplementation. And their results also approved the clinical efficacy of saffron in this patient. So multiple studies in different countries with different methods showed that saffron supplementation can improve clinical response in patients with age-related macular degeneration. Please, next slide. The other field that saffron is clinically investigated was for glaucoma. Glaucoma is ocular hypertension, or glaucoma is an important disease. This disease has a large burden on visual loss in all countries, and this disease has no complete cure. And many investigations are done for finding new treatments for this disease, glaucoma. One team from Iran showed in another city that saffron supplementations can decrease the intraocular pressure and have positive effect on glaucoma and on the intraocular pressure of patients with glaucoma, but the effect size was minimal, just 2 millimeters of just 2 millimeter Hg decreased the IOP. The response was significantly, statistically significant, but the clinical significance was low. The next slide, please. And Stuttgart macular dystrophy is a rare disease. It is a congenital disease, rare disease in the retina. And another team from Italy showed in another city that saffron supplementation can improve both ERG and visual acuity of patients with Stuttgart macular dystrophy. This disease also has no proven treatment, and saffron supplementation shows some promise and some hope for treatment of this disease. Next, please. Besides these clinical studies on the effect of saffron supplementation in AMD, in glaucoma, and in Stargardt disease, besides these clinical investigations, multiple preclinical studies have been done on the effect of saffron in other eye diseases. For example, this study is an animal study for the effect of saffron on cataract. Please, next slide. This study also about the saffron administration. They showed that it can prevent an experimental cataract in animal study. The next one. And this study also was done experimentally on animal model for the effect of saffron on dry eye. Lacrimal gland excision is an experimental model for dry eye, and they showed that saffron supplementation can improve the ocular surface disease in this experimental model of dry eye. But for these indications, for example, cataract and dry eye, we do not have any clinical research and any report from clinical research on the effectiveness of saffron for these indications. Please, next slide. It is a study, a clinical study from Iranian researchers that have been registered in IRCT, but their report have not been published yet. It is just the registrations of clinical trial and the effect of saffron on dry eye. Next one. Besides the current knowledge that I have mentioned in previous studies about the effect of saffron on eye diseases, which are mostly on the retinal disease, we can perform multiple studies in future about the effect of saffron on eye disease. The first future perspective is about eye drop for ocular surface disease from saffron. As I mentioned in the current studies, mostly they have used nutritional supplementation of saffron, but in Persian medicine, as I mentioned, saffron have been used in multiple topical ophthalmic formulations. So one of areas of research on the effect of saffron in eye disease can be development of ophthalmic formulations from saffron, and also studying saffron on the ocular surface disease. For example, for pterygium, for example, for dry eye. Dry eye is the most prevalent eye disease in the world, and many patients complain from the symptoms such as tearing, such as burning, foreign body sensation from dry eye, and as I mentioned in Persian medicine, kohl of saffron kohl or saffron ophthalmic formulation typically have been used for this disease, ocular surface disease, I mean, for example, pterygium and dry eye. This is another area of future research. We can focus on development of ophthalmic formulation from saffron and study the effect of this formulation on different ocular surface disease like pterygium and like dry eye as the most prevalent and burdenous eye disease. Next slide. Please click. Next. And we have done multiple studies on the effect of saffron in our center, for example, on wound burn. For example, we have published some reviews about the effect of saffron in different disease, for example, in neurological disease. The next one, please. And also about thinking about saffron as a kerosene, which is a most important ingredient of saffron in as a vision supplement. As you know, visual supplements are a great market, and we can introduce saffron and its ingredients like kerosene as a visual supplement and add this to other nutritional supplements that are routinely used for eye diseases and retinal disease. The next one. We are currently the next slide. We are currently work on the effect of kerosene in a clinical trial on one retinal disease that have not been previously investigated, central serous corridor retinopathy. We are evaluating in our center in a clinical trial that if kerosene can be effective in treatment of this disease. The next one. If the colleagues are working on the effect of saffron or other nutritional supplements or traditional medicinal plants on the eye diseases, I want to announce you that we have jointly worked with European Journal of Integrative Medicine on a specific special issue about integrative approach to eye disease. And we can publish both originals and reviews in the field of traditional medicine and in eye disease. And I invite you to send us your manuscripts in this field, and we would be happy to publish them if you have worked on medicinal plants in the field of eye disease. Thank you for providing with your times, and I am here to answer if you have any question. Thank you.
Thank you very much, dear Dr. Haydari. It was a really informative presentation. So let's see if there's any question in the comments. I remember one of the participants asked a question about saffron in eye diseases and eye formulations. I think the answers are, the question is answered to a high extent in your presentation. So is there any other question regarding saffron in eye diseases? So for those dear participants who joined us a bit late and especially who want to get a CME point from the webinar, don't worry, the whole symposium is recorded, and if you couldn't be in the live presentation, you can join, you can visit the recorded file later. Just let me explain the issue in Persian as well, because of our Iranian friends. همکاران عزیزی که بابت بازآموزی وارد برنامه شدن، اگر دیر وارد شدید برنامه به طور کامل ضبط شده، بعداً میتونید فایل ضبط شده رو ملاحظه بکنید و فایل ضبط شده رو بعداً میتونید ملاحظه بکنید و از برای پاسخگویی به سوالات امتحان ازش استفاده بکنید. اطلاعات بازآموزی هم در سیستم کامل ثبت شده بوده. زبان برنامه هم از قبل مشخص بوده که انگلیسی هستش. So فایل ضبط شده در وب پیج برنامه قرار میگیره، هم وب پیج اصلی. So is there any question regarding saffron in eye diseases? Dr. Haydari, as I think we mostly focus on crocin as one of the major ingredients of saffron in your presentation. I was wondering if saffronol as the volatile compound of saffron is also involved in its therapeutic effect in eye diseases. What do you think about saffronol?
As I saw in the research, published research, mostly they have focused on crocin. Some of them has mentioned that they have used saffron 20 milligram per day, but I think they have also used crocin, not saffron. As the retina, in the retina, we have some natural color pigments that they interfere with the physiologic activities of retina, and crocin can act as one natural color pigment in the retina. But saffronol does not have this rule. And also for ocular surface disease, I think that the main component that would be effective in the treatment of ocular surface disease is crocin, not saffronol. I did not see any specific indication or a study about the effect of saffronol on eye diseases.
Thank you very much. So as it seems that we have no question in this regard, I would like to thank you again, dear Dr. Haydari, for your informative presentation. We'll appreciate it. And let's continue with our next speaker, Dr. Yunus Monshi from actually Deputy Director at Center of Research in Unani Medicine, Ministry of Ayush, Government of India, who kindly accepted our invitation for this symposium today to talk about the uses of saffron and importance of saffron in Unani system of medicine. So, dear Dr. Monshi, thank you for joining us today, and the platform is yours.
Hello, am I audible?
Hello, yes, we have your voice, but we do not have your slides yet. If you share,
I'm going to share. I'm going to share. Let us check audio first. Let me say good morning to the people who are our brothers who are in Iran, and good afternoon to the people, to our colleagues who are in India. So there is a bit of time difference. And assalamu alaikum to everybody. I'm going to share my slides, although let me see. So is my screen visible?
Yes, it is visible.
Okay, I'll go for the slide mode. Let me see how I can do it. Just a minute. So is it in slide mode also?
Yes, we can see your slides.
Okay. Since I think Persian medicine and Unani medicine is not having so much of difference, and a lot of things have been already cleared by our earlier speakers. I am highly thankful to them that they have decreased the burden from my shoulders. So basically, let me start from what I think the Unani medicine, where from it has evolved. It is historical background. It is basically the 3rd and 4th century AD, where the traditional medicine. I assume that the Unani system of medicine is the period from the period of development from traditional medicine to modern medicine. So it starts from 3rd and 4th century from your country, that is Iran, from Jundishapur, where the school was opened, and all the that was the first national integration of different traditional medicines to place, and the literatures from different countries, be it India, Ayurveda from India, Chinese medicine from China. Those literatures were translated in Pahlavi language, which now we call as Persian. And then the integrative approach was developed. And after all these developments up to the 17th century, when bacterial theory came and penicillin was invented, until then, the people relied on these, and the development during the periods, different periods, like we developed the preparation of majun, khamiras, then extracts, tinctures, and alcoholic extract, aqueous extract. So this is the development from. This is what I was telling. We will not go into the details, but the Unani system is basically the Indian name of what you call as Persian medicine, and we also follow the same fundamentals of Avicenna, of Razis. Most of the scholars of Unani medicine have been either from Persia or from Spain, Andalus. So now coming to the basic fundamentals, what I said, what Persians also believe in it, that we believe in preventive care, we believe in protective care, we believe in curative care. Then we have the promotion of the health also. There are different fundamentals. Are my slides moving? Can you please tell me that? Are my slides moving? No, they are not. Okay. I'll let it happen. So this is that it has a preventive, protective. Now, Kamil Saab, are my other slides visible? Yes, they are now. Yes, they are now. I think so. Let me see if I can go for.
Dr. Munshi, do you have my voice?
Yeah.
If it's possible, please put your slides into slideshow mode so we can see your slides.
I had put it. I had put it in slide mode, but they are not moving. Now I have pressed the F5, and I'll see if I can press F5. Then it may come to the slide mode. I was already in slide mode, but I don't know why slide mode is not available there. I'll again share the screen. Just a moment. Just a moment. Now, do you see the slides like in a slide share mode?
Yes, now it's okay. Thank you.
Okay, thank you. So we have the preventive, we have the protective, then we have the curative, and we have the promotive healthcare in United System of Medicine, what we believe. Then we have different fundamentals, what we call as kuliyat ilaj, kuliyat adawiyya. These are basic fundamentals of what we follow during the treatment and during the prescription of the medicine. So, as you know, the fundamentals of the Unani medicine are dependent. We depend on humors. We believe in humors and 4 temperaments. and the disease also, if there is any discrepancy or disbalance of the humors, that give rise to the ailments. And all the diseases have unique temperament. Based on the temperament of the person and the disease, the drug is being prescribed. So here, the diagnosis and the treatment according to United system is based on the humoral theory and the temperament that we discuss it. There are 4 humors in the body. This our Persian brothers and our Indian brothers also, they know it well, and this I don't think that this needs to be repeated. Then let us move to the Kuliat Adviya. So we have in United System of Medicine, every drug has its own temperament, and drug, whether single herb or the compound formulation, has its has been divided on the basis of the temperament. We have even the dosage of the drug depends on the temperament of the medicine. Temperament of the medicine, temperament of the person, and the age of the person. So we have hot and wet. It is then further divided into 4: degree 1, degree 2, 3, and 4. Same case is hot and dry, degree 1, 2, 3. This I am saying because on this basis we there was a question earlier that what is the dosage of the saffron. So saffron also, the dosage depends on the temperament of the medicine, as we can see in the future slides, what its temperament is. So we have hot and dry, degree 1, 2, 3, 4. First degree you can go up to the 10 grams also. But when it is 4th degree, it is having more toxicity. We go into the milligrams. It is 40 to 60 milligrams on. So you can see the difference between the temperaments. In 1st degree temperament, you can go up to 10 grams, whereas in the 4th degree temperament of the drug, you have to minimize the dose up to 40 to 60 milligrams. In 4th degree comes your opium, arsenic, other poisonous drugs, whereas in 1st degree, they are mostly used as the food items. So here we have the 4 subdivided into further 4. The hot and wet, hot and dry, cold and wet, cold and dry, degree 1, 2, 3, and 4. So now coming to the main topic of saffron. As this is the costliest spice, or the herb, we may call it spice or the herb in the world. Since I'm from Kashmir, so there in the local saffron fields, we get per kg at the value around rupees 2 lakh per kg. Its name is kurkum, basically, which has been derived from the Persian word kurkumas, and in India it is called as kesar, while as in Kashmir it is called as kong. So according to Gilani, who has been the scholar of the Unani medicine in India, it is 3rd degree hot and 1st degree dry. So that is why it is dosage has been limited to 3 grams based on this. While as in certain cases, the dosage has been increased to up to 5 grams also. So as per the Unani classics, almost all the scholars of the past have mentioned saffron as a medicine for different diseases. According to Zikra Razi, he has mentioned saffron as ingestion of 6 to 7 grams of saffron induces delivery. So he has told that I prescribed it many times, and the results were always positive. So here we have, according to Adviya Mufarda from Hakim Safiuddin, it is Mukavikal. It has anti-inflammatory properties. It is being used to increase the vision. That is what we saw in the previous presentation, that this has been used in the ophthalmic diseases. But since the modern people rely on the biomolecules, we use it as a whole stigma of the flower to relieve the inflammation of the nasal mucosa, and in different diseases of the heart also. Well, in my future slides, I'll show how this has been validated by the modern medicine also. As per the Khazan al-Adwiya by Najm al-Ghani, the saffron is being used as medicine in Unani medicine in various ailments, It is used as tonic for kidney, bladder, and liver. It removes the blockade of gallbladder. It cleans what we call as tankia of kidneys and bladder. It is used as concoction for the bad humors, which we call as munzij. We have one therapy here, munzij and musil, where we go for the concoction and then concomitant therapy. So this produces that concoction of the bad humors. It is used as anti-inflammatory and carbonative also. It prevents humors from putrefying, thus prevents the health of phlegma from purification, and thus prevents the disease caused by the derangement of humors. Then we have again from Rajmagani, it is being used as for renal colic. It has been used for the pain, redness in eyes, and also increases the vision. So for that, it is being used by 5% of saffron is being that what we call as in some arkiat is it is being ground in the arkiat. We call it as kharl. So kharl to do the kharl of the saffron in arkiat, where only 5% is being used, and that is, then the drops are being installed in the eyes. So for that, as per the Unani medicine, but in modern, we can't take so much of risk for the infection, and then they use the biomolecules. But biomolecules have one problem, that we can't determine the temperament. If saffron is having third degree dry, hot and dry temperament, it is biomolecule, it is phytoceutical, protein, and other phytoceuticals. We don't know the temperament of those. And so in Unani medicine, we refrain from such prescriptions where we can't determine the temperament of the medicine. So it has been used as sedative also. It has been used for eye injury. Some physicians have used it for dysmenorrhea also. It is also used for the tremors, then migraine. It is being used along with the ghee, pure ghee, not the ghee which has been obtained from the vegetables. Unani medicine has described it as adverse effects also. According to Razi, it produces nausea, vomiting. If given in larger doses, it can prove poisonous also, as it acts against the acidic reaction needed for the digestion. So excessive use can damage the lungs also. It also gives rise to headache. It can reduce the appetite, as I have already told over here that it acts against the acidic reaction needed for digestion. So there is loss of appetite. And Unani medicine has already given the corrective measures also. Then that if there is some adverse effect in the lungs, then we can use aniseeds. And if there is other adverse reaction, we use resin of the zirshik berberis, fruit of berberis. So here we can say some of the Unani concepts have been validated, as saffron has been proven in several studies to control cardiovascular functions. As in Unani medicine, it has been told that it is Mukavi Kalp. So cardiovascular functions have been corrected by saffron, then maintained fundamental vascular tension, and play a significant role in maintaining the circulatory system. Then by reducing oxidative stress and dyslipidemia, crocin is in saffron may help to avoid diabetes-related cardiovascular problems. So in red, you can see the reference of the slide. Then it is having antioxidant activity. That means it can be used as what we call as Mukhavi Azai Reisa. So that antioxidant activity has been also proved by the study inhibiting free radicals. Many researchers like Carter Bernard and et al. Have published the study in critical review in Food Science and Nutrition in 2022, where saffron extracts have been used as antioxidants. Furthermore, the antioxidant action of the saffron has been demonstrated in vivo investigations also in asthmatic mice bronchial epithelial cells. This has been done by Bukhari et al. In 2015. Phytotherapy research published. Then anti-tumor properties have also been seen, and in that case, we have one compound medicine, Davalocurcum, which is under investigation in Pune. The project has been sanctioned by Symposium, and they have proved, although the data is yet to be published, but they have proved that Davalocurcum can be used for anti-cancer, especially for liver cancer. So anti-tumor properties are there, which has been proved by Trantelis et al. In 2003. Then, as I said earlier, Unani has already mentioned that it is having antidepressant effects. It is sedative. So this also has been proved by the study by Somaya et al. In 2015, which has been published by Journal of Food Science and Technology. Then we have its action on the neurological disorders. We have in Alzheimer's disease, saffron extract, particularly transcrocitine, lowers the A42 in monocytes in Alzheimer's disease. This has been already published in Journal of Neurological Sciences by Tribuzi et al. Then anti-Parkinson's effect has been also proved. So what Unani said that it has it acts as neurotonic. So that has been proved because our scholars were not having so much of sophisticated laboratories. Their laboratory was the human body. Whatever they were seeing, observing, they tried to record that, and on that basis they have said that it is a neurotonic. But since they were not aware that there are different neurological disorders where it acts, so modern scientists using their modern gadgets have proved that which compound is responsible for which efficacy. So apoalpha lactobacillus is being suppressed by crocin and saffronel, what is available, the phytoceuticals from the saffron. So this has been the study has been done by Purushothaman, which has been published by Journal of Parkinson's Disease in 2013. Then we have effect on neuroinflammation also, where crocin has decreased the neuropathology. Then effect of brain neurotransmitters has also been studied. So this is what we can call that this is a validation study of what already Unani has, and there are various diseases where Unani has mentioned it, and then there is a need of validation of those diseases as far as the saffron is concerned. Thank you very much for your patient listening. Thanks.
Thank you very much, dear Dr. Munshi, with your interesting title, Saffron in Unani medicine. And as all dear participants saw, many aspects of saffron in Unani medicine is similar to Persian medicine. So it was interesting to find these similarities between different medical doctrines, complementary medical doctrines all over the world: Thai traditional medicine, Persian medicine, Unani medicine. And I hope for the next symposiums we can also gather scientists from other doctrines of traditional medical sciences to compare these indications and contraindications and see the differences and similarities. So one of the participants asked you to please go over the last slide one more time. I think there was an information that she wants to review.
Just a minute. I'll again share the slide. Just a minute. Just a minute. You want this slide, no?
So
This is the last but one. Last slide is this. Last but one is this.
yeah, the one before the last one. Yeah, Dr. Sarah, he wants to see this one. So here, Sarah, do you have any question about this slide from Dr. Munshi? And Alzheimer effects? So very useful information. And again, if you want to see this slide or any other slide of other lectures, you can view the recorded file of the symposium. So don't worry if you missed some slides. And thank you very much again, dear Dr. Munshi. Our participants also mentioned some neuropsychological effects of saffron, anti-Parkinsonian, anti-Alzheimer effects. Yes, all these topics are actually investigated regarding saffron, and several of them are demonstrated in preclinical and clinical studies. So thank you again. I appreciate your actually presence in this symposium, and I hope we have the chance for having you in our future symposiums, webinars, and other collaborations with our colleagues in India. We have several mutual projects with our Indian colleagues due to the similarities between Persian medicine and Unani medicine, and this made these collaborations actually facilitate these collaborations, and I think it would be really nice to continue these scientific collaborations.
I have already shared the presentation in the chat box. Anybody who wishes to download it, he can download it. Nothing doing.
Thank you. That's really kind of you. So Dr. Munshi has shared the presentation on the chat box. So if anyone wants to download the PowerPoint, please check the chat box. Thank you very much. That's really kind of you.
Thank you, ma'am. Thank you, ma'am. Thanks a lot.
So with this presentation, we can continue our program with Dr. Ghazal Haydari Rad. I saw her camera, so I think she's available in the room. Yes. Hello, dear Dr. Haydari. Dr. Haydari is a medical doctor, PhD, and assistant professor of Persian medicine in Shahid Beheshti University of Medical Sciences in Iran. And she is going to talk about one of the formulations of saffron, which is highly prescribed and consumed in Iran, which is called julab, and cancer-related fatigue in patients with breast cancer. So dear Dr. Haydari Rad, many thanks for accepting our invitation, and the platform is yours.
Hi, colleagues, dear colleagues. Hi, my name is Ghazal Haydari Rad. I am MD, PhD of Iranian Traditional Medicine, and I am a faculty member of Shahid Beheshti University of Medical Sciences. Today, I wanted to share with you a good experience of a saffron-based beverage that name is julab. The subject of my lecture is about efficacy and safety of julab, a saffron-based beverage, and cancer-related fatigue in breast cancer patients in a double-blind randomized clinical trial. As you well know, fatigue is a common complaint in cancer patients that profoundly affects the quality of life. Fatigue is an unsettling, persistent subject sense of physical, emotional, and cognitive exhaustion or tiredness that's related to cancer or cancer treatments and cancer remedies. That is not related, fatigue isn't related to recent activity and considerably interfere with normal functioning. Cancer-related fatigue is common both among those who have undergone cancer management and also cancer survivors who have finished treatment. Although the true incidence of cancer-related fatigue is difficult to discover, according to previous study, it's estimated that cancer-related fatigue affects approximately 70 to 100% of cancer patients in general. Pathophysiology of cancer-related fatigue is depending on different factors such as the type and stage of cancer, treatment modalities, cancer treatments such as chemotherapy, radiation therapy, hormone therapy, or rapid tumor growth, and etc. Also, it can by some cancer side effects or cancer treatment side effects such as anemia, unrelieved pain, anxiety, sleep disorders, poor nutrition, and individual patient characteristics. Why complementary remedies or complementary and traditional recommendations can be helpful? Since fatigue is a multi-cause problem, also the pathophysiology of cancer-related fatigue isn't completely understood, and available treatments are not quite satisfactory. And as much as I know, there isn't a gold standard for fatigue, especially for cancer-related fatigue. So traditional and complementary medicine remedies can be helpful. Persian medicine, also known as Iranian traditional medicine or Persian traditional medicine, is a holistic system of a healthcare that has its roots in ancient Iran. It is one of the oldest continuously practiced medical systems in the world, dating back over 2,500 years. Julab in Persian medicine manuscript is known as a tonic beverage, as a mood enhancer. It has been prescribed by Persian medicine scholars as a nervous system relaxant, as a tonic for cardiovascular, and they believe, Persian scholar believes that Julab can enhance heart function. Also, it can be a tonic for gastrointestinal tract. Julab in studies. The safety and efficacy of these traditional beverages have been previously evaluated in some medicinal conditions, such as functional dyspepsia and deep depression. The result of these studies confirm the knowledge of the Persian medicine scholars who have recommended Julab as a nervous system relaxant and as a tonic for gastrointestinal system. How is Julab made? As you know, Julab is a mixture of saffron, honey or sugar, and rose water. In this study, at the first, we mixed honey and rose water in the temperature of 70 to 80 centigrade. And when they mixed completely, at the end, saffron was added and Julab was made. Aim of the study was to evaluating the safety and efficacy of Julab beverage in the management of cancer-related fatigue in breast cancer patients. The trial design was a randomized, double-blind, double-arm. There were two parallel arms, placebo-controlled clinical trial. This study was done at the outpatient oncology clinic of the Shohada Tajrish hospital in Tehran, Iran. In this study, the inclusion criteria was women with breast cancer suffering from fatigue, and the age of woman was between 18 to 70 years, with a confirmed histologic diagnosis of breast cancer, who were referred for chemotherapy. Symptoms of fatigue developed after starting chemotherapy, and who didn't have fatigue before. If the breast cancer patient who complaining of fatigue met the inclusion criteria, after signing the consent, enrolled the study. They were randomly divided in two groups. One group was intervention group who received Julab beverage 20 milliliters 3 times daily, and the other group was control group who was received placebo beverage 20 milliliters 3 times daily. The number of participants in intervention group was 38, and the number of participants in control group was 37. For decreasing the bias in the result of the study as much as possible, the chemotherapy drug were the same in all participants. Both groups. And results. All participants in both groups were evaluated before and after the intervention. First, the outcome measures was a visual analog fatigue scale, fatigue severity scale questionnaire, and cancer fatigue scale questionnaire. These outcome measures one time were complete before intervention at in week 0, and finally at the end of the intervention in weeks 4. And the duration of intervention was 4 weeks, and the result of this study showed that visual analog fatigue in Jollab group was significantly decreased, while it wasn't a differences in the placebo group. Visual analog fatigue in placebo group, no significant difference. The other outcome measure was fatigue severity scale. That result shows that FSS or fatigue severity scales in the average decreased significantly in Jollab group, while in placebo group it slightly decreased, and the decrease not significant. And final, the cancer fatigue scale, that is a questionnaire that is specific for evaluating fatigue in cancer patients, and it has 3 subscales: physical, cognitive, and affective subscales. And the result of our study showed that with using Jollab, the cancer fatigue scale in the average cause physical subscale significantly improved. Also, cognitive subscale significantly improved, while but affective subscale didn't improve significantly. And in placebo group, none of them improved significantly. Discussion, as I mentioned, the cause problem, and different factors such as physical stresses, mental and psychological stresses, social stresses can cause fatigue. And Jollab with various positive effects, such as good effect on improving depression, good effect to improving functional dyspepsia, and positive effects in cardiac function and nervous system, can have good effects to improving fatigue. And the results show that physical and cognitive subscales significantly improved. I say that physical subscales that significantly improve include mobility, pain, overall physical function, physical endurance, and activity of daily living. And cognitive subscales that significantly improve, including memory, attention, problem-solving skills, and language comprehension. And finally, we can conclude from the result of this study that Jollab, as a saffron-based beverage, has significant positive effects on reducing fatigue in women with breast cancer. And this is the picture of our published article in Complementary Medicine Research. Thank you for your attention. If you have any question, I am at your rest.
Thank you very much, dear Dr. Heydarirat, for your presentation. This was actually a very valuable work in the field of integrative oncology. Well, there are a lot of discussions regarding the use of natural products in patients with cancer, because there's always a concern about herb-drug interaction, whether the natural product, the herbal supplement, may interfere with the cytotoxic mechanisms of anti-cancer drugs, and that is always a matter of actually question for all healthcare providers, patients, and those working in this field, but providing a clinical trial, which is somehow the highest level of scientific evidence, would solve this problem. So based on clinical trials like this, we can clearly understand that the use of such complementary medicines would help patients relieve their side effects, the side effects of actually chemotherapy or radiotherapy. I know that Dr. Haydari Rad has worked a lot in the field of integrative oncology, so it is not just the use of Julab. If you're interested in this field, I suggest you to follow her articles. I think this field of complementary medicine, complementary and integrative medicine, which is going to help patients with cancer, is one of the important subdivisions of our fields of study. So let's check the questions in the chat box. Dr. Firuzi asked whether the syrup is Julab syrup is contraindicated in diabetic patients. I think because it is based on the traditional formulation, traditional actually instruction, it contains a high concentration of sugar. It is naturally forbidden in diabetic patients. What do you think, Dr. Haydari?
Yes, the use of sugar is should be limited in cancer patients, and honey has many anti-cancer effects. So in this study, because of cancer patients, we use honey.
So the
for our
sweetener was
Julab.
honey. Yeah, perfect. It was somehow a kind of reformulation and correction of the traditional formulation. This is actually what traditional pharmacists are supposed to do, to obtain the idea from traditional textbooks and try to reformulate the traditional formulate and actually prepare it in the form which is acceptable based on modern pharmaceutical considerations. And for the target patients, like in diabetic patients, we are not allowed to use high concentration of sugars, or in cancer patients, as Dr. Haydari Rad mentioned, maybe honey is a better replacement for sugar. So there's another question that we're preparing this formulation at a temperature of above 80 degrees centigrade, not have a negative effect on bioactive compounds of honey and saffron. Well, or rose water. So I think the last speaker, the last lecture in our keynote speakers would better answer this question, because Dr. Inche and his colleague are going to talk about different methods, actually the ideal methods for preparing a saffron extract. And I'm sure in their presentation, they will also talk about how temperature may affect the content of active ingredients of saffron. But generally, in such studies, as I'm sure it is done, it is considered in Dr. Haydari Rad's study, a kind of standardization process is considered for the natural products used in the studies. So I think the measurement of active components were considered in the studies so that they could know which amount of crocin or saffronol or other major active ingredients of saffron were available in the final product after all those processing and heating and other processes.
Excuse me, I want to say something. Higher temperature can make a furfurat, high furfurat for boiling water, boiling honey, and it is dangerous. But when the temperature is about 70 to 80 centigrade, the amount of furfurat is safe for using too.
Thank you very much. Dr. Munshi has asked, in Unani system, Julab means purgative. Is this same Julab or something else? Actually, in Persian medicine, we only call this specific formulation Julab. So it is just a mixture of sugar or honey or other sweeteners, saffron, and rose water. So it is, I think in Unani system of medicine, Julab is a general term as purgative, but in Persian medicine, no, it is just about this specific formulation? And oh, too many questions. Dr. Paknejad asked whether you record adverse events in the study groups.
There isn't a very serious adverse effect, just one person from itching. And after after discontinue the Jola is good, it will be good. And one person had a headache. Just two these side effects were reported.
So the side effects were reported in answer to the question of our dear participants. Of the formulation. So thank you again, dear Dr. Heydarirad, and I hope we have the chance for having you in our future programs as well. Thank you very much.
Thank you.
So after this nice presentation, I would like Assistant Professor of Pharmacognosy at the Department of Traditional Pharmacy, Tehran School of Persian Medicine, Tehran University of Medical Sciences. She has worked on saffron as the effect of saffron as a bioenhancer on the pharmacokinetic of acetaminophen. So, dear Dr. Sadati, hello, and thank you for joining us. The platform is yours.
Hello, Dr. Barham Sultani and everyone. I hope to have a good time. The title of
excuse me, Dr. Sadati, I think your internet connection is a bit weak. I was wondering if you can turn off your camera. Maybe it helps for a better voice quality.
excuse me, can you hear me, Dr. Barham Sultani? Dr. Barham Sultani, can you hear me?
Dr. Sadati, we have your slides and we hear you. Thank you.
Yeah, okay. Thank you. The title of our study is Effect of Saffron as a Bioenhancer on Pharmacokinetic of Acetaminophen, an animal study. This study was carried out in collaboration with the departments of pharmaceutics and pharmacology and toxicology in Faculty of Pharmacy in Tehran Tehran University of Medical Sciences. As you know, in pharmaceutical science, two terms of drug delivery and drug targeting are used in modern pharmaceutical, and researchers have introduced several methods in order to improve delivery and targeting of the drugs. So drug delivery technologies have been proven to improve treatment outcomes in many ways, including enhancing therapeutic efficacy, reducing toxicity, increasing patient compliance, and in the viewpoint of the traditional Persian medicine, effectiveness, low side effects, and acceptability of drugs are important factors in pharmacotherapy that can be achieved through combination of drugs. In this regard, drug delivery and targeting with the aim of increasing efficacy of the drug has been one of the unique topics in TPM. And for this purpose, medical scholars combined some excipients with the main drug to keep it from being digested and speed up the absorption and its distribution to an organ, also sustaining its release or targeting to a specified organ. In the review of traditional Persian books, we have a term called Mubatraq, or in English, we can say convoy drug or accompanier agents that are a group of modifiers or musleh in Farsi for the effects of the main drug. These agents have a good and rapid penetration to the entire body or a specific organ, so they can increase the speed of drug delivery to the site. And thereby they enhance the presence of drugs in particular organs. In this study, we studied saffron, that is a medicinal plant from Iridaceae family and has been used as medicinal plant, spice, color, and food flavor. And also it has been mentioned in TPM books as a convoy drug or mubatraq in polyherbal formulation or in a mixture of herbal in complex formulation. Also, saffron can convey drugs to heart, brain, and other organs. On the other hand, we use acetaminophen, a chemical drug, for evaluation the effect of saffron on its pharmacokinetic. As you know, acetaminophen is an acetyl aminophenol or paracetamol that has been used as analgesic and antipyretic properties. Acetaminophen has high oral bioavailability and its absorption is totally in the small intestine, and it is well absorbed and reaches the peak blood concentration within 19 minutes after ingestion. And also it is not widely bound to plasma protein and has a plasma half-life of 1.5 to 2.5 hours at the recommended doses. So we choose this drug because it doesn't have complex pharmacokinetic, and the study was not complicated. So the aim of this study was to evaluate the effect of oral co-administration of saffron on the pharmacokinetic parameters of acetaminophen in an animal model. In method and material part, we prepared saffron and acetaminophen, and also the preparation of drugs was as follow. Acetaminophen was, and also the powder of the saffron was dispersed in water. Acetaminophen dose was 10 milligram per kg based on the other animal studies, and also we choose these dose of the saffron because based on the TPM books, the dose of saffron, if it is used as a convoy agent, must be lower than its therapeutic dose. Both of these suspensions were completely shaken before intake, and after that, in animal study, we used the male vistorate that were divided randomly in two groups, which contains 6 animals. In two groups, one group was a control group that received acetaminophen at dose of 10 milligram per kg by oral gavage, and second group was test group that received acetaminophen suspension at a dose of 10 milligram and a solution containing saffron powder at a dose of 4 milligrams simultaneously. In this slide, you can see the schematic of our methods. We used both drugs by gavage, and after gavage, the animals were anesthetized by ketamine and xylazine, and the blood samples were taken at 0 time, it means before gavage, and after gavage at the times of 5, 10, 15, 20, 40, 60, 90, and 120 minutes. The blood samples were centrifuged and the supranatal plasma were taken, and after the extract of the drug from the plasma, the samples were injected to the HPLC UV instruments, and the peak of the acetaminophen that was detected in the chromatogram in the plasma of the samples. This is the HPLC analysis condition. I passed from this slide. You can see the conditions of the column, the mobile phase, that was phosphate buffer and acetonitrile in isocratic system, and other conditions. After that, we spiked acetaminophen in plasma without a drug, and prepared the stock solution, and after that, different dilutions of acetaminophen from 1 to 100 microgram per ml concentration were prepared from this stock solution. And then the drug was extracted from the plasma, and after filtration, injected to HPLC UV. These steps were repeated 3 times, and the other part, the plasma analysis method, was done with methanol solvent. We use this solvent to extract the acetaminophen from the plasma medium, and after centrifugation, the supernatant was filtered and injected to HPLC for analysis. In the result part, you can see the acetaminophen standard for spiked in the plasma chromatograms from 1 to 100 microgram per milliliter. This chromatogram belongs to plasma without the drug. This is for acetaminophen with 1 microgram per milliliter, 2.5, 5, 10, 25, 50, and 100 microgram per ml. And after that, the peak area of acetaminophen concentrations spiked in the plasma were analyzed, and this table is the data about the peak area. And after that, the calibration curve of acetaminophen concentration in plasma was drawn, and you can see the calibration curve and the line equation. By using this equation, we could measure the concentration of the acetaminophen in the samples. And in this slide, you can see acetaminophen chromatograms in plasma. This is for control group. The above chromatogram is for acetaminophen in 0 time, and after that, this chromatogram is about acetaminophen concentration in 120 minutes. You can see the peak of acetaminophen that appears between 2 and 4 minutes, and the peak of this the run time of the acetaminophen is around 3 minutes. And this part is the chromatograms of the control of the test group. You can see the plasma in 0 minutes and the acetaminophen in this sample at 20 minutes after gauge. And these charts is about the acetaminophen concentration versus time from 5 to 120 minutes after gauge. You can see in 6 animal, you can see these charts. This chart belongs to control group, and this chart belongs to the test group that represent the acetaminophen concentration at different times. And this is the mean acetaminophen concentration chart. You can see the that the blue line belongs to acetaminophen group, and the orange line belongs to the test group that the acetaminophen and saffron was used concomitantly. After analysis of the data, we could found that there was a significant difference between the plasma concentration of acetaminophen in 2 groups at the times of 5, 10, 15, 20, and 14 minutes after drug gauge, while there was no significant difference between the acetaminophen concentration at times from 60 to 120 minutes after drug gauge. So another factor that is important in pharmacokinetic of the drugs is the AUC, or area under the curve. As you may know, AUC is representative of the total amount of drug absorbed following administration of a single dose of the drug. We analyze the AUC at a time at different times from 0 to 120, and between the difference between 2 groups was analyzed. As you can see, the AUC at the time 0 to 60 is statistically different, and the difference are significant between these 2 groups. So as I said, analysis of AUC from 0 to 60 minutes in the 2 groups showed significant difference, while when we measured or calculated the AUC from 0 to 120 for two groups. We found that the control group, the AUC of the control group was around 300 and the test group was around 400, which is a little more than the control group, but it's not statistically significant. Another point in pharmacokinetic is the maximum concentration and the time that the drug reaches to maximum concentration is important in pharmacokinetic of the drugs. Our results showed that the concentration of acetaminophen in the test group was reached to the maximum concentration faster and began to decrease after 60 minutes of consumption. While in control group, acetaminophen concentration was slowly increased and concentrations continue to rise for 120 minutes. For discussion of our data, we researched the previous studies, and it was found that the result that the previous studies showed that gastric emptying is one of the effective factors in increasing the rate of acetaminophen concentration in the blood. And according to the result of our study, the rate of acetaminophen absorption in the test group was higher than the control group. That it can be, it may be due to increase the gastric emptying effect of saffron. According to TPM text, saffron has hot and dry nature, so it can be enhance the stomach and muscle strength, and also it has been mentioned that saffron is astringent agent or qabez in Farsi, and also has gastric tonic effect. So it can be considered to cause faster gastric emptying. Therefore, one of the reasons for increasing the rate of absorption of acetaminophen and also possibly other oral medications can be attributed to gastric emptying property of saffron, which it requires further experimental and clinical studies to be approved. In conclusion, we concluded that saffron can be used with drugs that need to pass faster from the stomach and be absorbed more rapidly. In this slide, you can see my email and also two articles that were published. If you have a question, questions about convoy agents in traditional Persian medicine, you can read these articles. And thank you for your attention. If you have questions, I'm ready. I don't have your voice.
Thank you very much, Dr. Saudati, for your nice presentation. It was actually interesting because you evaluated one of the hypotheses of Persian medicine regarding the convoy effect of saffron in improving or affecting the pharmacokinetics of other drugs. And this is kind of actually sample. It can be a kind of model used for other drugs claimed in Persian medicine, which may which may act as bioenhancers or bioavailability improvers of other medicinal plants or other conventional medicines. So I think it's has two conclusions. The first one is approving the hypothesis of Persian medicine regarding the effect of saffron on the pharmacokinetics of other pharmaceutical, other actually drugs. But the second outcome is also the possibility of herb-drug interaction between saffron and other conventional medicine. However, I think it is highly dependent on the dose of the saffron and also the dose of the drug. So it would be interesting idea for our colleagues or those who are interested in this area to test this model saffron or other medicinal plants in the same model using paracetamol or other conventional medicines to clarify regarding herb-drug interactions. So thank you very much for your presentation, and let's see about some comments here. One of the participants asked about limit of detection and limit of quantification you used
Yes.
for your method.
Yes. The quantification of LOD and LOQ was not our aim of our study, and we didn't measure these parameters. But for a standard study, we should measure the LOD and LOQ. But it was not our.
Yeah, as you're explaining, I think LOD and LOQ are used for when you're establishing a standardization method. So
Yeah.
this study didn't have such aim. The main aim was to assess the changes in the serum concentration of acetaminophen when concomitantly used with saffron. So the method, the standardization method, and how these concentrations were measured was established in previous studies. It was not the main aim of the study.
Yes.
So, and one of our participants mentioned that saffron may reduce acetaminophen liver metabolism. Yeah, that is also a concern for not just saffron, but also many other plants which may affect cytochrome P450 or other sub enzymes of liver metabolizing drugs, liver metabolizing enzymes. So this should be assessed in future studies. But the main aim of this study was to assess the claim of Persian medicine.
Yes, I have yes. You, as you know, the major metabolism of acetaminophen is in the intestine by glucuronidation, and the little part of the acetaminophen is metabolized in the liver by cytochromes, and it make into toxic metabolite of acetaminophen. If some agent increase acetaminophen liver metabolism, it can increase the toxic metabolite of acetaminophen. So the use of saffron is not a concern in this regard. So I think any agent that reduces acetaminophen liver metabolism is okay. It's not a problem.
Thank you very much. And I think the paper, the article of this research is under review, and I think it will be recently, I mean, in near future, it will be published online. So if our participants are interested in finding further details, I suggest them to just wait a little, and then they can search the name of Dr. Narges Sadati and find the full text of the article, because I know it would be online soon in future. So
Thank you so much.
thank you very much, Dr. Sadati. I appreciate it. Thank you for joining us. And yes, our next year's speaker has unfortunately was not able actually to deliver his lecture live, but he was so kind that accepted my invitation and he recorded his lecture for our symposium. He is Dr. Roy Upton, the president of American Herbal Pharmacopoeia, and it is a very great honor for our symposium and our school to have Dr. Upton as one of the speakers in this symposium. Our team had many previous collaborations with Dr. Upton, as you will see in his presentation, and in this lecture, he is talking about the importance of saffron and how Eastern countries, Asian countries, and traditional medical doctrines in Asia, and especially Iran, have introduced saffron as not just a spice, but a medicine into Western medicine. And I invite you all to listen to Dr. Upton's presentation, which is now played for you.
Good morning, salam. I want to thank the organizers for inviting me to make a presentation regarding the development of a monograph and therapeutic compendium for saffron for inclusion in the American Herbal Pharmacopoeia. One day I hope to be able to make this presentation in purpose. I would love to visit Iran. I have many friends there, and I look forward to one day being able to visit. So thank you. American Herbal Pharmacopoeia is a nonprofit, non-governmental herbal medicine research organization based in California. Our primary purpose is to help establish quality control standards for herbal ingredients and to provide critical reviews of the therapeutic and safety information regarding herbal medicines. Our primary goal is to reintroduce Americans to the use of herbal medicines, as most Americans lost any knowledge of their traditional herbal medicine by about 1935. 1935 was the year when most formal herbal medicine education ceased in the United States, and it didn't start up again until sometime after the 1960s. So the United States has been without a formal system of herbal medicine for many decades, and part of the American Herbal Pharmacopoeia's work is to reintroduce Americans to the value of herbal medicines, as well as to provide industry and regulators with the analytical tools and the knowledge needed to comply with good manufacturing practices regarding the manufacture of herbal preparations. Now, while saffron is well known as a spice worldwide, including in the United States, its use as a medicine has persisted to current times, predominantly due to writings of Persian physicians such as Ibn Sina. I met a young man on a shuttle bus a few years ago, and he was from Iran. And when we were talking about what each of us did, I mentioned I was a medicinal plant researcher, and he said, "Oh, you should learn about our great physician, Avicenna, Ibn Sina." And he was delighted to hear that I had two different translations, English translations of Ibn Sina's Can of Medicine sitting by my bed. So the writings of Ibn Sina are precious to many worldwide, including in the West. In addition to the Middle Eastern literature, saffron was featured in early Western herbal medicine literature from the 1st century herbal of Greek physician Dioscorides of Greek through other medical authorities up until the Renaissance herbals of the 16th to about the 19th century in Western Europe. Saffron was also included in official medicinal preparations in most Western herbal pharmacopoeias up until the 19th century. Then after the 19th century, then we saw the chemicalization of medicine, and many herbal medicines were discarded. Now, despite the inclusion of saffron in official compendium, the use of saffron rapidly declined in the West. In England, its use as a medicine was almost completely disregarded by 1857, and medical authorities of the time were mixed regarding their opinions of whether or not saffron was actually efficacious or not. Some physicians extolled its benefits and value as an efficacious medicine, while others completely disregarded it as useless. This may have been due to also at the time reports of adulteration of saffron, which persists today. Perhaps the physicians who felt that saffron was beneficial were using authentic saffron, and perhaps those who considered it useless were using one of its common adulterants, again, those of many of which persist today. So saffron was also included as an official ingredient in the first edition of the United States Pharmacopoeia up until, and that's in 1820, up until 1890, at which time many of the herbal medicines started to disappear out of the pharmacopoeias. At that time, the majority of saffron was obtained from England, Spain, and France, at least the saffron that was in the United States. We know today that 90% of the world's saffron is exported from Iran, and that's including saffron that's in the United States. And at the time, there were numerous reports of its adulteration, again, most commonly with things like safflower, Carthamus tinctorius, or sometimes calendula flowers, Calendula officinalis. Again, at the time, there was mixed reports regarding its efficacy. Now, prior to 2015, saffron was only used as a spice in the United States, and almost no one in the medical herbalist community used it medicinally. We just didn't know about it. I've been studying and practicing herbal medicine for more than 40 years, and I never learned of the medicinal effects of saffron until a few supplements were introduced to the American market around 2015, and I started researching it and looking at its historical literature, and got very excited about its potential, about using it medicinally from a clinical practitioner perspective. But up until that time, there were almost no saffron supplements in the market. And since that time, there's awareness regarding its potential benefit has grown, but it's grown very slowly. So there's still a long way to go to teach people about the benefits of saffron in the United States and in the medical community. Now, American Herbal Pharmacopoeia had already collaborated with Iranian researchers in the development of a monograph and therapeutic compendium for lemon balm, Melissa officinalis. Lemon balm is very, very popular in the US, but part of our purpose in developing the monograph was to promote international collaboration between countries and researchers that otherwise may have political differences that prevent us from collaborating on different things, especially collaboration with medicinal plants. Those of all of us, I believe, who are dedicated to medicine in some way, shape, or form have a shared value of wanting to serve humanity. And so this was one of our reasons for reaching out specifically to Iranian researchers in collaboration with the Melissa monograph. And we started with a template, a paper that was developed by Beshat Javadi in Iran, and her team at Mashhad University, and also included other reviewers from Iran. And we were very grateful for that collaboration and created a extremely well-developed and beautiful monograph on Melissa with their collaboration. We also have begun collaboration, and this has been going on for a few years, on Materia chamomilla, a very important botanical, again, in Western herbal medicine, but also in Persia, and where we've collaborated with Professor Aman Zagaran and his colleagues and his team at Tehran University of Medical Sciences on the development of a monograph and therapeutic compendium for chamomile flowers. And this monograph is ongoing in development. When we decided to develop the monograph for Saffron, we reached out to other numerous reviewers and researchers in Iran, as well as Iranian researchers that live here in North America now. And so we're actively engaged in the development of the Saffron monograph and therapeutic compendium, and look forward to its completion, which we hope will be in the middle of next year. Each of the monographs, because it was relatively new as a dietary supplement, there were no quality control standards. And everybody is aware saffron is one of the most commonly adulterated plant ingredients in the world. So we've worked with different researchers and collaborators on developing standards of botanical identification, macroscopic and microscopic identification, characterization with HPTLC as well as HPLC characterization, so that when this is completed, it'll represent the most complete monograph and therapeutic compendium that exists in the English language, at least in North America. In addition to providing the standards of identity, purity, quality, and testing, we also provide information regarding cultivation, harvesting, and post-harvest practices, including the sustainability of the botanical. And again, as everybody knows, this is a very highly adulterated botanical, and so this information is critical for anybody involved in the trade of saffron. Each therapeutic compendium has a section on history, pharmacokinetics, pharmacodynamics, dosages, a complete safety profile looking at adverse effects, how it's used in pregnancy and lactation, interactions with conventional drugs, contraindications, cautions, potential for carcinogenicity and mutagenicity, and full toxicological review, including its traditional use in Persian medicine, so that we preserve the traditional knowledge of saffron and not just look at it from a Western scientific perspective. In addition to the monograph, in collaboration, the American Herbal Pharmacopoeia, in collaboration with the American Botanical Council and National Center for Natural Products Research, have released a bulletin on the adulteration of saffron through our collective botanical adulterations prevention program. And all of this is a multi-organizational, multi-international collaboration on making the world aware of the adulterations that occur in botanical medicines, not just with saffron. And all information that we publish is open access, free of charge to anybody, by simply going to the American Botanical Council webpage and accessing any information on the Botanical Adulterants Prevention Program. So with that, we're grateful that Iran has nurtured the world's commercial supply of saffron for literally centuries and has passed on that knowledge regarding its health benefits to the rest of the world. It's our hope that those involved in the saffron trade in Iran will continue this work with much peace, and that we look forward to further collaborations on not only on the saffron monograph, but on other monographs in the future. With that, I say thank you for your kind attention. I look forward to future collaborations and hope to be able to visit in person one day. Thank you very much, and I wish you much success with the rest of your conference. Thank you.
So I'm sure you all enjoyed Dr. Opton's perfect presentation, and I know the quality of the sound was a little low because it was a matter of the original sound. But the main file of the presentation will be uploaded on the Symposium webpage, so you can download the original file, which has a better quality of slides and, of course, the sound. So, as you saw, Iranian had a lot of collaborations with American Herbal Pharmacopoeia, and it is our honor, and we hope these collaborations will be continued in future. So, as the next speaker, we are having Dr. Bashir Ahmad Ali. Dr. Bashir, if you are in the room, would you please raise your hand so that we can give you access as co-host? Dr. Bashir, are you in the room? Yes, yes, he is in the room. So we're giving you host access in a couple of seconds. So Dr. Bashir Ahmad Ali is a professor of agronomy, Kashmir University of Agriculture Sciences and Technology, and he's going to talk about climate smart agronomic manipulations for resilient saffron production and livelihood security. So I think he has problem connecting. He was in the room a couple of seconds ago, but dear IT colleague, Dr. Bashir Ahmad is online. Dr. Bashir A. Elahi, would you please give him co-host access? Just a minute, it is okay. So dear Dr. Bashir, you're now co-host and you can share your slides from the bottom of the page by share screen.
Yes, am I audible to you?
Yes, we can hear you and we have your slides.
Thank you, ma'am. First of all, I am thankful to you people, organizers, that they have provided me this chance to share the achievements done by our university for this saffron. And I am from Sukast, Kashmir, that is known for this saffron cultivation, where this station is situated. And this is the representative of the area where saffron is grown in India. And if we
Dr.
see,
Bashir, would you please turn on your slideshow so that we can see the slides full screen? You just need to click on slideshow on your PowerPoint.
I have shared my slides.
Yes, it is shared, but if you can turn it on full screen, I would be thankful.
Okay, okay, okay, I will try.
Yeah, at the bottom of the page. Yeah, thank you very much.
Is it okay?
Yes, okay, perfect, thank you.
Yes, I have been asked to give this one talk, that is climate smart agronomic manipulation for a resilient saffron production and livelihood security of our farmers. And if we see the scenario of saffron in our country, this is the second largest after Iran. And at present, we have around 4,000 hectares of saffron land in our country, and we are producing more than 18 metric ton of saffron. And this is the scenario of saffron of the world scenario, where Iran is the leading country, followed by India, and then other countries, those who are growing saffron. And if we see the trends of saffron, that how saffron is being produced in India from 1997 to up to 2018, there has been a decreasing trend in area, and then also in a decreasing trend in production and productivity. And this is the reason why I have shared this presentation, because climate change is the major thrust. Because of this, we are having the reduction in production as well as the productivity of this saffron, very important spice. This again, the production productivity trend in Jammu and Kashmir of saffron. And again, this is how we are growing saffron in Jammu and Kashmir, and we are growing saffron because of altitude, not because of latitude. That is grown as is done in Iran. And we are harvesting saffron in October, and after October, that goes to vegetative stage after November till end of April for corn production. Then what are the constraints behind this, why we are having this reduction in the yield? There are some major constants which are responsible for this low production, that is moisture stress, because earlier the distribution pattern of rains that was uniform. When we require for the saffron cultivation, the rains that happens in past, but now it is not happening like that. And there is now we are recommending that farmers, they should apply irrigation at critical stages. Then second most a constant for this saffron production is senile fields. The now fields, they have not the optimum plant population of corms in saffron fields. Then again, the lack of adequate quantities of saffron corms, that is a right quality. A weight of corm and size of corm, that plays important role in flower production. Then again, the nutrient starvation of the saffron fields, because nowadays we are seeing that saffron which have been grown from the past few centuries, farmers, they are not applying any kind of nutrients to the fields, and fields. Now we feel that they are hungry, and then farmers again, they use longer planting cycle of saffron corms, more than 15 years. That is the again very big constant, that there is corm load, maximum corm load in fields, and the corm size remains small, and because of that the production of the saffron is low. Then again, incidence of pest and disease, that is the constant again, and harvesting. When farmers they harvest the produce from the saffron fields, then the suppression of stigmas from the flowers, that is being delayed. If the yield of the saffron flowers is maximum, then it is very difficult to harvest and separate stigmas from that produce. Then quality deterioration due to the traditional sun drying, because farmers they are drying their produce in traditional ways, and that is again the problem that is constant in quality of the saffron. Then there should be a quality, there is no quality control, and uh, certification and branding. Now we have one spice park that has been developed, and that is responsible for this GI tagging saffron. We have been given the award of GI tagging to Kashmiri saffron, and now farmers, because of that international trading center, farmers are getting good remunerative price from that particular spice park. And then again, what our universities they have done, what kind of role our university is playing for increasing the production for this important spice. That this university, India, is the one only we have developed one variety globally. That was the first, that is known as Shalimar Saffron 1. That is the only unique variety that has been developed from India. Then again, we have devised the irrigation module, when farmers should apply the irrigation, how and how much they should apply irrigation to the saffron fields. Then the optimum plant population that is required for the saffron production for high density as well as for the normal density. Then nutrients starvation, as I already told. Then nutrient management is the important, because fields they are after over the period of several decades they are hungry, and we have devised nutrient management module. Then quality improvement for saffron, how farmers should go for drying, and how they should separate their stigmas, and how they should pack their produce. And then the very important intervention that is now we have been carrying out at our research station, and we have demonstrated that technology to the farmers, that is indoor saffron cultivation. Farmers they have now adopting this cultivation, where they are getting good produce from their respective residences. And then again the saffron calazira intercropping, because farmers they claim that we are not getting the remunerative price from from the saffron area. And now we have devised one technology that farmers should go for the saffron calazira as well as almond intercropping, so that farmers can earn more and more from per unit area. Then weed management in saffron. And if we explain the things in the detail, this Shalimar Saffron 1 is the variety that is now yielding. Farmers they are harvesting 60 kg of saffron with good quality of crocin, picrocrocin, and saffronol. And the benefit cost ratio that is exhibited from this variety, that is 3.26:1 as against the natural population. And then irrigation module, we have devised that farmers they should apply 5 irrigations, 3 before flowering and 2 after flowering, so that they can harvest a good produce of saffron, and as well as there will be a good corm yield from saffron fields. And this is the irrigation schedule, how and when they should apply the irrigation in saffron fields. And this is the pictures which we have taken from the resource station as well as the farmers field, how and when, how should they apply, and what is the impact of the irrigation module on saffron production. Then again, the optimum population. If we talk of we have recommended different densities for saffron production, that is normal density as well as the high density module for saffron. And for getting maximum yield, we recommend that farmers should go for high density module, that is of 10 lakh columns per hectare, with the plant geometry that 5 columns should be placed in one ditch at spacing of 25 into 15 centimeters, so that farmers can harvest around 5 to 6 kg of saffron per hectare, as compared to the traditional normal density, that is around 2 to 3 kg of saffron when they plant only 5 lakh columns per hectare. And this is the method how they should plant columns and how they can go for get good column production from the respective fields. This is again the saffron fields with good bunch of flowers and vegetative good vegetative phase from saffron fields. And then a nutrient management module for this saffron fields. We recommend that farmers should not apply then inorganic, as well as they should go for integrated nutrient management system where they can apply both manure as well as inorganic fertilizers to the saffron fields, so that they can harvest a good saffron yield from the saffron fields. This is the schedule how they should go for applying the inorganic as well as organic fertilizers in saffron fields to harvest good saffron from saffron fields. Again, this is the one intervention that is nowadays, that is a trend. Every patch of farmers where they are interested in saffron cultivation, farmers, they are also intending to have this kind of structure to do indoor saffron cultivation in their respective homes. And we have devised, we have recommended, and we have demonstrated that if a farmer or any industrial people or those who are involved in saffron cultivation or entrepreneur, they can erect indoor saffron structures and harvest good yield of saffron from that structure. And we have given an example of, we have erected at our research station 20 by 20 feet multi-tier structure that yielded 1 to 1.5 kg of saffron from that area under normal condition, under ambient condition. But a person or those who want to do indoor saffron cultivation in non-traditional areas, they will have to erect some controlled conditions where they can have this kind of facilities, and they can also harvest good yield of saffron. This is recently that we have erected indoor saffron structures at our research station, and we have presented one bouquet of flowers to our Honorable Prime Minister of India by Honorable Lieutenant Governor of UT&K during last year. And the beauty of this bouquet was that we have deferred the flowering of this bouquet by 10 to 12 days, and that was presented to the Honorable Prime Minister of India. And this is again the visit of dignitaries to our indoor saffron structure that was erected at our research station. Again, this is the farmers visit, and we have one awareness program. Our Honorable Vice Chancellor, he was the chief guest of that occasion, and that was they were very much happy with this technology, that farmers now they are ready to adopt this kind of technology at our respective homes. Again, these are some glimpses of indoor saffron cultivation that was demonstrated to farmers. And the important thing of this indoor saffron cultivation, what we have seen, that there are three things that are responsible, that because of these three things, we know the saffron, that is crocin, picrocrocin, and saffronal. And we have tested that these three things are more found in indoor saffron as compared to outdoor saffron. The units that we have observed, that we have depicted here. And again, one technology, that is intercropping of saffron with kala zira. And once we go for sole saffron cultivation, and we are harvesting around 45 kg of saffron with total returns of this much. And again, if we go for alone kala zira cultivation, then we are harvesting 320 kg of kala zira per hectare. And by this intervention, we can go for intercropping of saffron kala zira, where we can harvest both saffron and kala zira with additional remuneration of, that was around Indian rupees of 18 lakh rupees per hectare. And if we see the alone sole saffron returns, that was around 6 lakh per hectare from saffron and 16 lakh from kala zira. And by this intervention, they can earn more, and farmers are happy with this technology, and they can even intercrop this almond crops, almond trees in saffron kala zira fields. These are some glimpses and dignitaries they have visited to see their performance of saffron as well as kala zira intercropping that was demonstrated at our research station. And then one more intervention, that was weed management in saffron. We have done with controlling winter weeds by application of Materia. That was significantly we have achieved good results by controlling winter weeds in saffron. Then the quality parameters that are responsible for this saffron. Once farmers, they are having good produce, then farmers are advised to pick either unopened flowers or 2 days for opened flowers, so that they can have maximum yield of stigma, that is the economic yield of saffron, and they can earn more from their respective fields. This is some glimpses, pics of unopened and opened flowers, where we have observed that unopened flowers, they can retain the crocin, picrocrocin, and saffron content more, and we are recommending that farmers should harvest unopened flowers. This is again how this stigma separation can affect if we delay the separation by some time. And we observe that after picking up flowers, we should separate stigma from flowers within 10 to 12 hours of harvesting. Again, this is how after picking up flowers, then separation of stigma, they should go for, farmers should go for vacuum drying, where they can have quick and easy this drying of saffron, and where they can arrest these three things, that is saffron, saffronal, picrocrocin, and crocin, so that these things can be retained in saffron. Again, this is the thing how we can extend the shelf life of our flowers by keeping them at 2 degrees centigrade at relative humidity of 95 in cold chamber, so that farmers, they can separate their produce for stigma separation. At that we have now this facility is available at our Spice Park that was created by Government of India recently, where farmers, they bring their produce and keep the produce for 3 degrees at a temperature of 2 degrees centigrade, and 95% humidity. This is the how how long we can put and keep this, enhance the shelf life of our produce of saffron. Thank you very much.
Thank you very much, Dr. Bashir, for your presentation and especially beautiful images about agriculture of saffron in Kashmir. So, and thanks to Dr. Mohsen Dehlavi for explanation of Kala Zira is equal to black cumin. Thank you. So,
now it is a request to all, if you have any sort of query or anything you want to know from this side, I'm here to answer you.
Yes, please, if anyone has questions, can write in the chat box. And also, Dr. Bashir, I would be thankful if you write down your email address in the chat box so that if anyone would like to connect with you, they can reach you easily. So,
Definitely.
Dr. Sarah, who asked, is the symposium over now? No, we still have one keynote speaker. We will have actually a short break, and then we continue with the oral presentation sessions. We have 7 oral speakers, those who sent abstracts for us, and 7 of them are selected as oral speakers. So Dr. Dehlavi asked if they can cultivate saffron indoor in Delhi. So Dr. Bashir, can you tell if it is possible to cultivate saffron indoor in the climate of Delhi?
Yes, of course. This is query for me that anybody who wants to cultivate saffron in Delhi or in non-traditional areas or in tropical or subtropical areas, one can grow provided that he has that kind of facilities, I mean under controlled conditions, because saffron can be grown under controlled condition by giving that kind of facility, that kind of feel to saffron farms that they are in temperate region. Because if we see both in India as I mean in Iran, we can cultivate in open field conditions. Saffron needs 11 to 200 hours of chilling requirement, and that is very important. If that kind of thing, and during flowering or before flowering, once sprout initiation starts, that needs temperature that is required, that is needed in temperate region. I mean temperature that is around 22 to 25 degrees centigrade. If one can be able to give that kind of temperature, night temperature, day temperature, and the chilling requirement that is required in winter months, one can grow saffron. It is not impossible. But now, at the end of the day, we should know that whether the technology is cost effective for any person or not. If a person is pumping a lot of money, erecting structures, and at the end of the day, he will not harvest a good yield of saffron, that is not a good technology for him. So our recommendation is that initially one should go for small experimentation, see whether that is cost effective. If that is good for him, then he should go for bigger experiments.
I think, yeah. Thank you very much, Dr. Bashir, for your information and answering the question. Because we're a bit behind the schedule, I would like to directly continue to the next lecture. Our two next lecturers are dear Dr. Fatih İnce and Dr. Taner Erkaymaz from Turkey Süleyman Demirel University. And before the lecture, we are going to play a short video clip of the Natural Product Laboratory of Süleyman Demirel University, and then we will be with Dr. İnce.
Waalaikumsalam. Mohon sociology semua. Aspanya sih orang yang
So many different analytical devices, and it shows that a rich laboratory for natural products is available in Süleyman Demirel University. So hello, dear Dr. İnce and Dr. Erkaymaz. Thank you for joining us today, and you're interested to listen to your lecture about comparison of quality control standards of saffron with different drying methods. It is actually a very practical title. Very useful for anyone working on saffron, how to prepare the extract and how to dry to keep the highest amount of active components. So yeah, we have your slides, and go on. Thank you.
Hi, everyone. Thank you for your invite, Dr. Bahram Sultani. I want to say thank Dr. Rahimi, Dr. Bahram Sultani, Dr. Zargaran, and all people of the School of Persian Medicine. And thank the Wolfgang Amadeus Mozart for this good Ronda alla Turca. I am Fatih İnce from Department of History of Medicine and Ethics, Faculty of Medicine, Süleyman Demirel University, and my colleague Taner Erkaymaz from the Natural Products Application and Research Center of our universities. we have prepared different subject. I hope it will be good and useful, all of your participants and to our colleagues. This is our communication information. Please don't hesitate contact with us. Our presentation map is first of the saffron quality and saffron production in Fethiye. Fethiye is a country, touristic country in the southern Turkey. Preservation by drying methods and results. Now my colleague and my friend continues to the presentation.
Okay. Hello, everybody, and hello, dear academicians and dear my colleagues, dear masters. My name is Taner Erkaymaz. I am working for food quality and food safety in our university, Süleyman Demirel University, and we made some works with saffron product. And as you see, agricultural saffron production started in 2019 at Fethiye, Muğla. In this process of saffron production, we had a project, and the project was carried out in the Sudum Center within the scope of quality control studies. As you know, saffron quality is very important for its quality, and the drying process is very important for the storage and long-lasting use of saffron. It is desirable that saffron is dried in the most reliable way so that it doesn't lose its nutritive and useful properties. Because as you know, if you want to dry some foods, and after the drying procedure, you may lose some nutritive values or some chemicals decreasing from the beginning. So, as this procedure, we would like to explain something about these drying methods. As you know, bioactive compounds that reflect the characteristic properties of saffron are crocins, picrocrocin, and sofranol. Crocin is the chemical component primarily responsible for the color of saffron. It has various pharmacological effects such as antioxidant, anti-cancer, and memory-enhancing effects. So, we should dry our foods or our flowers for preservation at a long time. So, as you know, water activity is very important for preservation our samples or our foods. Water activity is defined as the ratio of the vapor pressure of water in a material to the vapor pressure of pure water at the same temperature. The relative humidity of air is defined as the ratio of the vapor pressure of air to its saturation vapor pressure. So, as you know, microbial growth and chemical reaction may occur only when enough water is present in food. So, we would like to dry our water from food or separate from food. So, dehydration accomplishes preservation in two ways. The first one is removes the water necessary for growth of microbes and for enzymatic activity. And the second one, the other one, is removal of water as it increases the osmotic pressure by concentrating salts, sugars, acids, thus creating environment which is unfavorable for growth of microbes. But as you know, we don't want to add chemicals to our flowers or our foods. It is not necessary, and it is a little bit dangerous because, as you know, chemicals have some problems in health problems. So, as you know, nitrates and as you know, salts are very dangerous for our health. So, we would like to choose for the drying methods. So after that, I will explain some drying methods. Choosing the right drying process is very important for the quality of saffron as measured by crocin, pecrocrocin, and saffronol levels. We implemented 4 different drying methods, and we made this drying methods, and after that we evaluated these procedures. The first one is conventional room temperature drying, as you know, and the second one is electric oven drying, is also a traditional method, and after that dehydration procedure using liquid nitrogen with oven, and after that the last one is drying by lyophilization. I would like to I would like to show you conventional drying sample photos, pictures, and we dried in 2 days our saffron samples at room temperature. As you know, not so bad. These colors are also very good, I think. But I will share our results of analysis and end of the presentation. And as you know, electric oven drying was applied and evaluated at 50-degree temperature during 4 hours saffron samples. As you know, you see the colors are also not so bad, but I think at the results we will explain something, this technique. And we implemented 2 different drying methods in this in our work. In this project, we selected this liquid nitrogen adding for drying method. As you know, the dehydration procedure using liquid nitrogen with oven was applied at 50 degrees temperature, and after that during 2-3 hours saffron samples. But we have some videos and we will share with you after presentation. And liquid nitrogen drying is also, you may see very easily. As you know, as you see, it is a magic picture, a little bit vaporization, boiling of nitrogen gas. Yes, we may show you these magic photos also. We have 2 different videos, and we will show you after our presentation. Yeah, I would like to explain lyophilization procedure. Lyophilization, known as freeze drying, it can be defined as a process that combines the benefits of freezing and drying processes to obtain a dry, active, long shelf life, and easily soluble product. So, lyophilization is very good drying technique, but as you know, a little bit expensive. But in the pictures, as you know, as you see, these colors are wonderful, I think, and we measured also. We will share our results. We have some procedure photographs, pictures also. As you know, we applied this procedure at minus 55 Celsius degree temperature and under 0.2 millibar pressure, and with approximately 24 hours for our saffron samples. As you see, we plated our saffron samples in 3 plates. These plates also heating plates, and after that, in this technique, we are using sublimation of water. And we have also lyophilization videos, and I will show you after our presentation. And we would like to share our results with you. As you know, we have a picture of a stereo microscope for saffron samples. As you know, oven drying is the left of a picture, and the medium of the picture is liquid nitrogen using drying, and the right one is lyophilization results. And I think in this picture, lyophilization drying sample is very bright orange color, and oven drying is also dark orange color, and liquid nitrogen drying picture is a little bit light orange color. But I may explain in the results show that the highest color intensity and quality criteria were obtained by freeze drying method. Is also the other name is lyophilization. In addition, more saffronal and kerosene were obtained in also lyophilization. The highest amount of kerosene reduction occurred in the dehydration method using liquid nitrogen. We have a table, results table. So we have some specifications, moisture and bitterness and saffronal quantity, and as you know, color strength. Now we measured with different wavelength with spectrophotometer, and after that we have some results, as you know, and drying by lyophilization is the best one, and the second one is also, as you know, oven drying is very good results also. The bad result, the worst one is liquid nitrogen drying, because I think contacting with very low temperature nitrogen, liquid nitrogen is decompose our chemicals, I think. And after that, because as you'll see, I will show you videos, temperature is going down approximately minus 100 degrees, and after that is going 50 degrees in the oven, and a little bit chemical decomposition occurred, I think. And I may say lyophilization advantages and disadvantages. As you see, advantages is little or no chemical changes will occur, and after that, little physical changes will occur. Nutritional value is almost completely protected. It is healthy also because there is no any chemical and there is no any other, for example, there is no oven media because no nitrogen, no oxygen in this procedure because we are making very high vacuum procedure. So with this procedure, vacuum is going down approximately 0 millibar, and after that there is no oxygen, there is no any chemical reaction. So long-term storage, approximately 20 years. And disadvantages, a high cost of equipment, as you know, very expensive instruments, and slow process. Average cycle is approximately one day, and a small amount of product processing. But this procedure, lyophilization procedure, is also has a scale-up procedure, but in scale-up, industrial usage is started some drying procedures in industry. And thank you so much for listening. Thank you.
And we will share some videos.
Yes.
For you.
Now we share our nitrogen, liquid nitrogen adding procedure. Yeah, you'll see we added one by one 100 milliliter liquid nitrogen to 10 grams of sample. Bir sonraki hocam. Herhalde bir sonraki gideceğiz hocam. Yine aynı yerde. Diğerine gideceğiz.
Onu nasıl yapalım?
Alta gidelim hocam. Altı tıklayalım. Yan tarafı tıklayalım hocam. Evet. Yes. As you see, a little bit magic video, very good, but a little bit dangerous also because some freeze burning may occur. Be careful. Yeah, we have lyophilization videos also. We covered samples after the first one and the second one with papers. Yes, it's going down. As you see, our pressure is going down now, and temperature is also okay. Yeah, thank you so much for listening.
Thank you for your interest, and thank you for listening.
The pleasure is mine. Thank you very much for informative presentation. I'm sure it is really useful for all those colleagues working with Saffron. So with this keynote speech, actually, let's see if there is any question in the chat box. One of the colleagues asked that actually liquid nitrogen produces minus 190 degrees centigrade, and how you optimize the temperature to 50 degrees centigrade. This is a question by one of the colleagues.
Videolar paylaşılmamış mı?
Dear Bahram Sultani, your voice level is low. We didn't hear you.
Is it better now?
Yeah, it's okay now.
So, okay, one colleague asked that a liquid nitrogen makes a temperature minus 190 degrees centigrade. How did you turn the temperature to 50 degrees centigrade? This is the question.
Approximately 100, minus 100. Because as you know, for nitrogen gas, going down to liquid form, approximately 90, minus 90 or minus 100 degrees. So we have a also nitrogen generator. We are producing our liquid nitrogen with our nitrogen generator. We have this facility. We have a good nitrogen generator, and after that we are using also this liquid nitrogen is into we have FTIR, for example, microscope FTIR. We are using also these liquid nitrogen to our other instruments.
Thank you very much. And okay, with this presentation, I think we are going to finish the keynote speaker session. And after a short break, just I think 5 minutes because we are behind the schedule, we're gonna start the oral presentation session, which is going to be moderated by my colleague, Dr. Nusha Ismailzadeh. And we're gonna have 7 oral presentations in this section. So just a few minutes of rest, and then we'll be back with oral presentation session. Thank you very much.
Thank you. Thank you very
Thank
much.
you so much.
We are going to okay, welcome back again. We're going to start the second session, which will be the presenters in oral presentation section. And we're going to start with Dr. Savaş Volkan Genç. And his presentation would be about the place and importance of saffron in Biruni's work, Kitab-ı Seydala Fit Tıp. Dr. Savaş, merhaba, buyurun.
Merhaba.
Hoş geldiniz.
Hoş bulduk. And hello there, their colleagues and their friends. Ruzbe Kahir. I'm Dr. Savaş Volkan Genç from Turkey, Burdur Mehmet Akif Ersoy University, Faculty of Veterinary and Department of Veterinary History and Ethics. And thanks for this opportunity and talk about Biruni and Kitab-ı Seydala Fit Tıp. Let's begin. Yes. And it's okay, I guess. And my topic, the place and importance of saffron in Biruni's work, Kitab-ı Seydala Fit Tıp. Biruni quotes the legend of the emergence of saffron from Galen. There was a boy, his name was Saffron. He was in the habit of playing with Hermes. One day, the ball he was playing hit his head and he died. The blood gushing from his head made bright bile form and gush. The great scholar does not explain saffron to us only with legend and stories. Biruni, in his old age, when he had vision and hearing difficulties, prepared his book called Kitab-ı Seydala Fit Tıp with the help of Greek student. It's the first pharmacy book written in history. He gives important information about medicine, pharmacy, botany, philology, and history of science in the book. The author also conveys his philosophical system, ethical understanding, and worldview in his work, where he says that behind the claims of alchemy, magic, charm, immortality, elixir, are the ambitions of people. The book, which draws the boundaries of medicine and pharmacy, was prepared by taking Dioscorides' book as an example. He examined in drugs in 3 groups, conveyed them in alphabetical order, and also included their side effects. Biruni, whom certain call it one of the few great people that the world has produced, was born on September 4, 973 near Kut, the capital of Khwarezm. Berthold called him the greatest scholar of the Islamic world. He wasn't very famous in Spain, which was a transition zone for knowledge, so his works weren't translated into Latin. And as a result of, he wasn't known in the Western world in the Middle Age. However, he appeared in some historical French texts under the name Master Ali Baron. He opposed the idea that science only provided practical benefits. He used the works of Hippocrates, Galen, Dioscorides, Oribasius, Aetius, Paulus Argentina, Theophorus Bombartus, and Aristotle extensively. Biruni, who was also familiar with Greek and Indian medicine, he argued that the reason for the emergence of science and essentially human needs and that natural science were born from medicine and veterinary medicine. In a study, Professor Dr. Esin Kahya and Professor Dr. Hakim Mohammed Said's translations of Kitab-ül Saydala fi Tıbb were used as main sources. The information given in the sources was examined by adhering to the methods of historical research and discussed with the studies done on the period and subject. Data collection, analysis, and reporting stage was followed according to historical research methods. Biruni naturally also dealt with saffron in his work. Saffron appears in 37 places. It has been examined in various ways such as zaferan, zaferan shaburak, saffron, saffron tree, saffron flower. In some places, it's also explained with the examples of poetry. Biruni begins to introduce saffron by saying its Latin and Syriac names. These are anicus, curcus, and curcuma. He quotes his Hindi names from Galen, Kesar, and Gangun. He says that yellow saffron is also called Jedi and Jidas, and he states that it's also known by the following names: Jest, Rambaukan, Mertkush, Radin, Kurkum, and Shar. He adds a line of poetry to the continuum of this information. Saffron ties her shawl. List the names of saffron leaves. These are Fait, Kumhar, Rikan, Hashf Rajoan, and Sharan. He relates that a woman who plucked saffron flowers in Dari called her Nebitan al-Kurkum in the local dialect. Biruni gives information from Dioscorides and Galen. According to Dioscorides, the strongest variety is those bearing red flowers and their hairs are slightly whitened towards the roots. It shouldn't be too oily or long. The skins should be easily separated. It's not harmful. It doesn't break into pieces. It's not damped. It has a pungent odor. According to Galen, 1 or 2 dirhams of the plant facilitates the birth of women. 3 dirhams are lethal. If drunk with wine as a desiccant, it stimulates the heart, intoxicates, and acts as a relaxant. Biruni also gives information from Muslim scientists. According to Hamza, its jaffran and its leaves, stems, and branches are called by this name in Isfahan. Abu Hanifa says that in Syria, Jeddi derives from Jadih, the name of saffron. Kutaybi says Ahir is the name of a perfume in composition. It's nothing but saffron. Asma'i writes as follows: Abir is a perfume composite of different substances with saffron in its compositions. Yahya and Pushki, Arab people mix musk with aloe vera wood and camphor. The best variety is musk, and its filters needs to be washed. It's then dried in the sun. Its fibers are thick, red, hard, and abrupt, and devoid of whitenesses. Bruni also classified saffron as quality. The second degree of clean and washed saffron is called turdar. This is followed by the Isfahani variety, which is further divided into two subtypes. Its name, Nami and Jani. Nami is a good variety. He refers to great scholar Razi. Razi describes it as bright white with fine fur and yellow. These are followed by the Shamiyan variety. According to Razi, this is the lower type, but it's higher than the Moorish and Yemeni ones. The lowest variety is from Khorasan. He also cites Abu Shalh classification. In our neighborhood in Khorasan, the Isfahan variety is considered to be the best. It's red in color, shiny and densely hair and fragrant, without white markings. Less quality in terms of quality is the Boni variety, as brought from Herat, followed by Savai and obtained in Valbastan. The next is Shumanji, and his Dagis is raised in Darhan. It's reasonably white but fragrant. In Sistan is called Zafaran Shaburak. Finally comes the Kashmir variety. It's red and has small white spots. Its effect is weak and has a strong odor mixed with oil and beef. All these varieties are cleaved. What is meant by cleaving is beating, crushing. It's also known as mathun. Its shape and top leaves are gently rubbed by hand, resulting in a sweet liquid dripping into the hand, which is emollient and puts the hand red. These are another type known as Asiri. This variety has the liquid on it. It's kind of like honey. This honey then accumulates inside the leaves. Even if it's transferred from one place to another, its amount shouldn't decrease. The fibers of the worst variety are pale, yellow, and white or tangled. To make it heavier, it's mixed with lead oxide, egg albumin, tendons, some coarse glands, and Chinese hair. Saffron is a medicine. Veroni describes saffron as a medicine.
Sorry to interrupt, Dr. Volkan.
Yes.
Only 1 minute is left.
Okay, it's finished. As follows, it's added to medical prescriptions, porridges, and preparations of drinks put in the mouth of the uterus. It's very effective in the stomach and liver. Its effect is moderate, and it's the most suitable for the temperament. It becomes heavier with sugar and wheat bread. Saffron has an important place in Kitabul Saydala Fit, the first pharmacy book in the world when the whole work is considered. Here we see that saffron was known and used long before Biruni, and a short literature review in today's world shows that saffron will have an important place in medicine, cosmetics, and gastronomy in future. And their colleague, müteşekkiren.
Teşekkür ederim hocam.
Ben teşekkür ederim.
Dr. Savaş Volkan has nicely reviewed the importance of saffron in Biruni's work. If any of the colleagues have any question about his precious presentation, we're ready to take it.
I guess no.
Okay, so if there's no question, we're going to move on to the second speaker, which is Sayed Reza Khatibi. Before starting your presentation, I want to mention once more that All the presentation have all the presenters have 7 minutes for their presentation and 3 minutes for Q&A. So please pay attention to the time. Thank you. Dr. Sayed Reza Khatibi is going to talk about feeding crossing, ameliorate cognitive dysfunction, oxidative stress, and neuroinflammation induced by unpredictable chronic mild stress in rats. Dr. Khatibi, the floor is yours.
Hello. Hello, everyone. Have you my voice?
Yes, your sound is audible. Would you please share your slides? Thank you.
I can't share slides.
So what is the problem? Have you shared it with okay, I think you have shared your screen. So please once more.
Yes.
Okay. So now open your PowerPoint file. We can see your screen, okay? And we can see your, okay. Yeah, yes, now it's visible. And if it's okay, please.
Thank you.
Okay, thank you.
In the name of God. Hello, everyone. I'm Sayed Reza Khatibi, MD, MPH, PhD in epidemiology from Torbat Haydar University of Medical Sciences in Iran. My colleagues, Farima Beheshti Doctor, Saman Kakhki. My title is Feeding, Crossing, Ameliorate Cognitive Dysfunction, Oxidative Stress, and Neuroinflammation Induced by Unpredictable Chronic Mild Stress in Rats. Memory, the ability to keep information, relies on the activity of several brain constructions, particularly hippocampus, as a main region involved in learning and cognition that is highly vulnerable to chronic stress exposure. Crossing yellow carotenoid as a main constituent of saffron, which is usually extracted from Crocus sativus L. stigmas, is well documented to exhibit various pharmacological effects, including anti-cancer, anti-depression, anti-anxiety, anti-inflammatory, memory improvement, anti-Parkinson, anti-diabetic, and protective effects on hepatitis. The present study is allocated to investigate the role of crossing on memory and learning impairment in rats induced by unpredictable chronic mild stress, UCMS, through assessing oxidative stress and inflammatory pathway by using behavioral and biochemical analysis. The 6 rats were divided into 6 groups. First, vehicle group. Second, unpredicted chronic mild stress, UCMS group. Third, unpredicted chronic mild stress crossing 10 milligram group. Fourth, unpredicted chronic mild stress crossing 20 milligrams group. Fifth, unpredicted chronic mild stress crossing 30 milligram group. And sixth, crossing 30 milligram group. UCMS induced 4 weeks and treatment group received crossing during these 4 weeks. The groups experienced different stressors throughout the 7 consecutive steps, including exposure to a wet bed for 24 hours, deprivation, and the deprivation of food and water separately for 24 hours, swimming for 5 minutes in cold and hot water 44 degrees Celsius and 45 degrees Celsius, respectively. Bending the cage at 45 degrees for 24 hours and pairing with another stress-induced animal for 24 hours. To avoid any habituation of the animal and regarding the essential aspect of the unpredictability of exposure to stressors in the UCMS procedure, the order of exposure to stressors must be varied weekly without repetition for 2 days. Vehicle and experimental groups received high doses of crocin with free access to water and food with no stress experienced. The day after UCMS protocol has been completed, animals were subjected to behavioral experiments, including a Morris water maze and passive avoidance. To analyze biochemical results, animals eventually were killed and had their hippocampal tissues removed. The Morris water maze has become one of the most widely used laboratory tools in behavioral neuroscience to measure spatial memory and learning. Passive avoidance PA test is used as an appropriate model to assess hippocampal dependent memory deficits in animal study, which is consisted of a box with grid floor and wooden walls divided into light and dark components separated by a gated door. Statistical analysis data were expressed as mean, positive, and negative SEM. The analysis of data for the MWM and PA test was done using one-way ANOVA followed by Tukey's post hoc comparison test in which the statistically significant differences were reported at p less than 0.05. According to the results, plasma corticosterone levels in the UCMS group were significantly higher than in the vehicle group. Pretreatment with crocin at either 20 milligram per kilogram or 30 milligram per kilogram significantly reduced this parameter. Although neither dose of the 10 milligram per kilogram of crocin nor administration of crocin 30 milligram per kilogram illustrated a significant difference in corticosterone reduction in comparison with UCMS and vehicle group respectively. The results from repeated measures ANOVA indicated group received UCMS demonstrated more time spent to find the hidden platform during 5 days training period and less time spent in the target quadrant in comparison with the vehicle, which determines the negative effect of chronic stress on spatial memory. Interestingly, crocin administration at dose of 30 milligram per kilogram significantly decreased the time spent to find and locate the hidden platform during the 5 days of learning trials on MWM, while increased the time spent on probe day compared to UCMS groups. However, a lower dose of crossing illustrated no significant difference with respect to UCMS group in both time spent to place on the hidden platform and latency time. Chronic stress could significantly decrease protective agents, including the total thiol content superoxide dismutase and catalase activity. Our study was also consistent with previous studies, which obviously demonstrated UCMS group had significantly decreased thiol concentration, SOD, and catalase activity. However, pretreatment with 30 milligram per kilogram of crossin indicated a significant increase in thiol concentration, SOD, and catalase activity, whereas pretreatment with 10 and 20 milligram per kilogram of crossin did not notably affect the mentioned parameters compared to UCMS group. Surprisingly, treatment with 30 milligram per kilogram of crossin in comparison with the vehicle group remarkably changed the thiol, SOD, and catalase activity. Regarding the
Sorry to interrupt. Only 1 minute is left. Thank you.
Okay. Regarding the prominent role of amyloid beta and GFAP, glial fibrillary acidic protein in the progression of Alzheimer's disease, the present findings demonstrated a significant reduction of GFAP in the administration of crossin at 10, 20, and 30 milligram per kilogram, whereas the reduction of amyloid beta was observed only at 20 and 30 milligram per kilogram of crossin compared with UCMS group. Surprisingly, GFAP concentration was decreased in groups treated with crossin at 30 milligram per kilogram, whereas no remarkable difference in amyloid beta was illustrated. In comparison with a vehicle interleukin-10 as an anti-inflammatory mediator in the UCMS group was significantly decreased, whereas administration of crossin at 20 and 30 milligram per kilogram remarkably increased the mentioned parameter. Interestingly, in administration of crossin at 30 milligram per kilogram also increased interleukin-10 with respect to vehicle. In UCMS group, compared to vehicle animals, the escape latency in the UCMS group were significantly higher than that in the control time spent. The time spent in target quadrant in UCMS group was significantly lower than control group. In the present study in UCMS group, compared to vehicle animals, the UCMS induced neuroinflammation and brain oxidative damage. Pretreatment crossin amyloid, neuroinflammation, and brain oxidative damage induced by UCMS. In conclusion, these results allow us to propose pretreatment with crossin have positive effects on learning and memory. The effect might be due to the antioxidative and anti-inflammatory effects. Thank you for your attention.
Thank you, Dr. Khatibi. Obviously, you and your precious team have done an elaborate study on the effects of crossin on ameliorating cognitive dysfunction. If anybody has any question, please write it in the chat box. So thank you. I think if there's no question, we can move on to the next presenter. Thank you, Dr. Khatibi. It was an honor.
Thank you.
The next speaker will be Dr. Roshanak Hariri. And her presentation would be about derivative spectrophotometric method for determination of synthetic dyes added in saffron.
Hi.
Hello, Dr. Hairi.
Hello. Can you hear my voice?
Yes.
Thank you so much. Let's share the how can I share my slides?
In the bottom middle of your screen, it's written that share screen. It's in. Have you seen it?
Yes, but I cannot share it with my mobile phone.
Do you want to share it from your phone?
Yeah, if it's possible. Let's. Because I cannot join to you from my laptop, I must join.
Okay, I think
from
there's
my
there's an
phone.
option written more with 3 dots. You can share it from there. It's written share screen.
I have shared. I have this share option here, but there is nothing for sharing, for example, PDF or PowerPoint or anything like this in this box.
You should open the PDF and then share it.
Unfortunately, I cannot do it another time. But I sent my slides to your email for this problem. You cannot open it from your email here.
Okay, Dr. Hairi, yes, we have your PDF, but we need some time to download it. If you don't mind, we would go to the next speaker and then get back to you.
Thank you so much. Excuse me so much.
No problem. So the next speaker, if Dr. Ashia Sultana is ready, yes. Do you have my voice, Dr. Sultana? Okay. So Dr. Afifa Kazemi. Dr. Afifa Kazemi, if you're hearing my voice, okay. Now you're a co-host and you can, okay. Dr. Afifa Kazemi is going to talk about compound formulation of saffron in respect of Indian National Formulary of Unani Medicine. Dr. Kazemi, the floor is yours. You can share your slides.
Thank you.
Thank you.
Is it visible?
Yes, it's visible and it's very beautiful. You have 7
Thank
minutes,
you.
Doctor. Thank you. Please pay attention to the time.
Thank you so much. Assalamu alaikum. I am Dr. Afifa Kazmi, PG Scholar, Department of Medicine, Government Tibbi College and Hospital, Patna, India. Topic of my presentation is compound formulations of saffron in respect of Indian National Formulary of Unani Medicine. Saffron or saffron derived from dried stigma of the Crocus sativus flower, cultivated in Iran, Greece, India, and other countries, has been a highly valued spice for centuries. It contains complex composition of more than 150 chemicals, which contribute to its countless medicinal properties. It is used as medicine for the treatment of many ailments in Unani system of medicine since antiquity. The Indian National Formulary of Unani Medicine have approximately 160 different compound drugs having saffron as ingredient. Not all of the compounds are given orally, but around 22 of them are for topical use in a variety of dosage forms. The dosage forms are, for oral use, there are two categories, Tewami and non-Tewami drugs. In non-Tewami category, there are hub, pill, tablet, distillate, powder, and in Tewami, which is sugar, honey, or jaggery-based preparations, Majun, a semi-solid preparation obtained by mixing powdered drugs in a base of honey, sugar, or jaggery. Other forms are khamira, jawarish, halwa, laboob, etc. For topical use, the forms are pill, tablet, oil, suppository, paste, eye dusting coolant powder, or kohl or surma. It has been saffron has been used in many compound drugs having different actions. I have categorized them on the basis of organ system in which they act. In reproductive system, the actions are uterine tonic, spermatogenic, immunogogue, sex stimulant. In gastrointestinal system, antiemetic, appetizer, digestive, anti-inflammatory for liver, constipative, carminative, purgative, or laxative, etc. In musculoskeletal system, anti-inflammatory, cicatrizant, repellent, sedative, etc. In cardiovascular system, the actions are cardiotonic, exhilarant, analgesic, deobstruent, blood purifier. In respiratory system, expectorant, anti-catarrh, anti-inflammatory, desiccant, chest relaxant. In urinary system, the actions are nephrotonic, diuretic, and lithotriptic. In nervous system, the actions are brain tonic, nervine tonic, nerve stimulant, hypnotic, narcotic, nerve relaxant, sedative, etc. In ocular system, vision improver, and anti-inflammatory, antiseptic, analgesic, repellent, etc. Other actions are general tonic, adipogenous, coactive, antiseptic, antipyretic, antidote, anti-epidemic effect, anti-bilious effect, etc. Likewise, like the actions, I also systematize the conditions where the formulations are being used. In reproductive system, the diseases where the compounds are used are atonic uterus, uteritis, licoria, amenorrhea in females, and in males, premature ejaculation, spermatorrhea, oligospermia, sexual debility, sterility. In gastrointestinal system, gastritis, anorexia, nausea, diarrhea, dysentery, cholera, intestinal worms, etc. In musculoskeletal system, it is used in many type of arthritis, gout, arthralgia. In nervous system, it treats headache, migraine, insomnia, neurasthenia, melancholia, hemiplegia, Bell's palsy, epilepsy, amnesia.
In respiratory system, cough, either dry or productive, catarrh, acute or chronic, sore throats, pulmonary TB, tuberculosis, or asthma. In cardiovascular system, weakness of heart, palpitations, hemorrhage, anemia, etc. It is also used in diseases of eye, conjunctivitis, burning sensation of eye, stye, blepharitis, vascular keratitis, pterygium, cataract, corneal opacity, diseases of urinary system, hematuria, incontinence of urine, nephralgia, diseases of skin, pruritus, ulcers, tinea infections, scabies, vitiligo, leprosy, etc. Other diseases where the compounds are used are generalized weakness, debility, asthenia, different type of fevers like septic fever, bilious fever, epidemic fever, hectic fever, compound fevers, etc. In the whole review of formulations having saffron, I have found that there are 150 formulations in which saffron has been used, treating more than 80 conditions and having more than 50 different actions. Of all the vast ranges, there are many compounds which have completely opposite actions and are being used in opposite conditions too. For example, the in central nervous system, action of the compounds are nerve stimulant, and some of the compounds are nerve relaxant. Similarly, in gastrointestinal system, some of the formulations are used in constipation, and some are used for diarrhea. I would like to conclude with the words that saffron in various dosage forms are indicated for various health and disease condition for preventive as well as curative purposes, but still need to be verified in recent parameters. Multi-centric rigorous clinical trials in bigger sample size are needed. Thank you.
Thank you, Dr. Kazmi. Is it over?
Thank you.
Is your presentation is over?
Yes, ma'am.
Thank you very much. You've done a great effort to actually collect all this information, and also you've done a great job in making these slides. Thank you. I think if there's any question, we're ready to take it. Thank you so much. So we're going to move to the next presenter, which is going to be Dr. Roshanai Khari. I think the technical problem has fixed. Please share the slides. Thank you. Dr. Khari, are you with us?
Hi.
Hi.
Thank you so much. I really appreciate this Congress. At first, I must introduce myself. I'm Roshanai Khari from the Medicinal Chemistry of Tehran University of Medical Sciences, and today I want to share our research about derivative spectrophotometric method for a determination of synthetic dyes added in saffron. As you know, saffron is the sigma of the string-like Corpus sativus plant, which is valuable as a seasoning and natural color and has many medicinal properties. Of course, saffron contains 3 categories of active metabolites. The first category is colored compounds of saffron, which are quercenes. They are water-soluble carotenoids, and like alpha-quercene and quercetin ester. The second category is picroquercetin, which is the main ingredient responsible for the bitter taste of saffron. And the third category is volatile oil, saffronol, which is responsible for the aroma of saffron. In recent years, saffron compounds such as quercetin, quercetin, and saffronol were under initial research for the treatment of various diseases because they are powerful antioxidants, and so they may prevent, for example, cancers, improvement, memory in Alzheimer's disease, reduce PMS symptoms, improve coronary artery disease, and we can use them as antidepressants. But as you know, most of the value of saffron is its color. The stronger the color of saffron, the stronger its taste and smell, really. And you can see in the next slide the chemical structure of natural colors of saffron, like quercetin and quercetin, that extensive round is done to create a color similar to saffron, which mainly includes the addition of synthetic edible colors in order to create a yellow-orange color and increase the intensity of the color in saffron. And in next two slides, you can see the chemical structure of yellow and red synthetic dyes, which we use in this research. For example, tartrazine, red 2G, and so on. If you please show the next slide. Yes, here you can see the 6 edible dyes, which we select them for this research and to determine the presence of them with this method. Of course, several methods are used to measure synthetic food colors. The most common reported methods are HPLC, electrophoresis, GC, and spectrophotometry. That spectrophotometric methods are of great interest due to their simplicity, low cost, and availability. But on the other hand, in the simultaneous measurement of several compounds by a spectrophotometric method, due to interference of absorption spectra, it's not possible to determine the value in classical condition. So one of the methods used to eliminate the interferences in the spectra and obtain quantitative and qualitative information is a derivative spectrophotometric method. Can you please change these two slides too, if it's possible? Yes, you can see different methods here for determining dyes in saffron, like HPLC and GC and spectrophotometric. And in the next slide, you can see the mechanism of the spectrophotometric methods and its benefits. And next slide, you can see the advantage of derivative spectrophotometric methods. This method is more selective and is used for the simultaneous measurement of many medicinal products and synthetic edible colors. The basis of work in this method is to measure the absolute value of absorption of one compound at a wavelength where the absorption of another compound is close to 0, of course. The derivative spectrum can be obtained in different degrees by comparing the derivative spectra of two materials. It's possible to obtain the points where only one of the materials has absorption, and therefore it can be measured at its wavelengths without interfering with the others. So in this research, we use derivative spectrophotometry to detect and determine the amount of color impurities in saffron. And to do this, you can see the method in this research in next slide. At first, 15 milliliter of distilled water was added to 0.7 grams of ground saffron, and the mixture was really stirred for 20 minutes. After separating the insoluble materials, the solution was separated and acidified by sulfuric acid to pH 0.1, and the solution was heated for 15 minutes, be hydrolyzed. Then the solution was cooled, and after centrifugation, the pH of solution was brought to 2 by sodium hydroxide, and the resulting solution was transferred to polyamide cartridge and washed with water, methanol, and acetone. And resulting solution were discarded. The residue was washed another time with a mixture of methanol and ammonia, and finally the solvent was evaporated, and resulting solution was dissolved in water. And after stirring for 3 minutes, it was filtered, and absorption spectrum of the solution was obtained directly to the spectrophotometer. Also, we use this method for preparation of the colors too. You can see in the next slide that the spectra of pure saffron, derivative, and colors in the range of 360 to 700 nanometer in different degrees from first to fourth order derivatives were prepared and compared. The points of the spectrum where saffron did not show absorption, but each of the colors has absorption were selected for the analysis of the desired color. And you can see the result in the next slide, that examining the derivative spectra showed that second derivative with delta lambda equal to 7 can be used to check and measure some synthetic colors, examining the absorption spectra of pure saffron in this range from 360 to 700 nanometers show 3 maximum and 4 minimum wavelengths. The absorption rate of pure saffron in the spectrum of the second derivative in the range of 480 to 640 nanometers is very small and reaches maximum of 0.007, while synthetic colors then have maximum absorption in this range. And finally, you can see the conclusion of this method, and that we found that Beer's law was obeyed in the range of 12.5 to 100 microgram per ml of each dye in presence of saffron. Limit of detection and limit of quantification of these colorants were acceptable, and you can see the range of them in this slide. And at last, it seems that a result of this study reveal that proposed derivative spectrophotometric method can be successfully used for a determination of 6 yellow and red colorants added to saffron. Thank you so much.
Thank you, Dr. Hariri. You've done a great job with actually finding, with developing a method for determination of synthetic dyes and dyes added in saffron. We really enjoyed your presentation. So I think if there's no question, I think we can move to the next presentation, which is Dr. Hamed Ahansazan, and he's going to talk about Materia Medica in art, the history of saffron painting in pharmacology books.
Okay, do you hear my voice? My name is Hamed Ahansazan, PhD candidate of History of Medicine at Tehran University of Medical Sciences. And the title of my presentation is Materia Medica in Art, the history of saffron painting in pharmacology
book. But at first, I would like to appreciate the organizer team and especially Dr. Saffron Sultani to holding this symposium. And in continue, I try to present my presentation quickly because of the time limitation. So in this presentation, I want to talk about the impact and the application of the art on the transmission of the knowledge of pharmacology. And finally, I want to comparing some images of saffron in pharmacology books. Okay, sure. Do you see my slide? Yes. Most historian of pharmacy talk about the art of pharmacy, art of healing and killing the person. But in this presentation, I want to talk about the pharmacology and art. Art as a method of translation and transmission a concept. In the history of pharmacology, we talk about the semiotic translation. That means an interpretation of verbal sign by means of sign of non-verbal sign system. For example, the painting, music, sign, or something else. And it is so important because it's so useful for learning from the manuscript, from the book, and from the painting in the book. For example, look at this image. We can understand something without any information about the Greek language. For example, I can understand that this paragraph, first paragraph, and this one is about the description and the definition, the properties, and the medicinal usage of Lilium candium. And probably this part is the name of Lilium candium in Greek language. So I can understand something just by seeing an image in a book. And the impacts of the painting on the transmission of the knowledge of pharmacology. We have many applications for the image and the painting in the scientific manuscript. For example, in this image, you can see the anise, that in Persian called anisun. And we can use just this image to education purpose or transferring the concept, making links between text and image, or simplifying the use of the book. For example, look at this image. This image for a book that the date of writing this book comes back to the 10th century in Greece. But this book used in Persia, Iran, by a person, and he wrote something in the side of the book. In this page, he wrote the name of this plant, anisun, to finding and finding this plant in environment. Okay. Do you hear my voice?
Yes, we can hear your
operator?
voice.
Thank
Yes,
you
we can hear you.
so much. Thank you. And let me go to the next slide. So in this slide, you can see the image of some pages of different manuscripts that are translated from Greek language or Arabic language. For example, this image. For example, this image is for a book that's date of writing. This book came back to the 10th century, and was translated from Greek language to Arabic language. Look at this part, the painting Saffron, and please compare with this image. This page of manuscript is for 13th century, and is translated and was translated in Iran, Samarkand, and you can see the many difference between this image and this one, and it's so interesting when translating book from the source language to target language. Why we can many changes, many different between the painting, the plant in this book. For example, in the book that were translated in 10th century, we can see the root of this plant is huge and different between between this one. Or look at this petals or leaves or stems, and this and the difference between another pictures. And the last images is for was written by a Turkish scholar in Ottoman Empire, and you can see that there are many differences between this image and the two other images. For example, look at this. Look at the leaves or the petals in the Turkish image, in the Turkish painting of Saffron, and the Arabic translated book. And this is so interesting when a translator translates a book from source language to target language, make many changes in the painting of the pictures and the maybe he localization, maybe he or she make a localization in the preparing a new manuscript, and in the history of pharmacology, we talk about these changes and the and the cause of the making these changes. So thank you for your attention.
Okay, thank you, Dr. Hamid Ahansazan, for your nice presentation on if actually you've reviewed the art in Materia Medica and this interesting topic, and all the pictures that you've collected. They're all very nice and made your presentation interesting.
Thank you.
Thank you. So for the last presentation, I want to share my own slides. Meanwhile, if anybody has any question about any of the presentations, please put it in the chat box, then we'll get back to it. So could you please make me the co-host? Niyusha Ismailzadeh, could you please make me the co-host? So I want to start my presentation. Just a moment, please. Okay, so sorry for the delay. I want to talk about saffron and introduce it as a Persian medicine adaptogen. So we're going to talk about different aspects of this topic. My name is Niyusha Ismailzadeh, and I am PharmD, PhD candidate of traditional pharmacy from a School of Persian Medicine at Tehran University of Medical Sciences. For the beginning, I want to just talk about the definition of adaptogens. I don't know if you've heard of them or if you've read articles about it, but adaptogens are, they can be herbal or they can be fungal. but most of them are herbal, and they have a specific characteristic, which is they can increase the adaptability, survival, and resilience of an organism during stress. So this kind of stress can be environmental, or it can be, for example, it can be from oxidation process. They have a specific effect on certain hormones in the body. They actually directly affect neurohormonal system of the body, and especially hormones like cortisol, which is called stress hormone, and it can also alter the status of an organisms. It can affect insulin, and also the other hormones like corticotropin releasing hormone and gonadotropin releasing hormone, as well as neuropeptide Y, which are all actually have very important effect in they have a very important effect in a stress condition. So by managing this hormones and trying to keep them in a balanced way, we can actually save organism from further damages, from further tissue damages, for example. And also we can help, for example, a person's mind and mental health. So adaptogens are actually important because they are easy, they are available way of keeping mental health. So there are some features for adaptogens. Generally, their mode of action is they're mood enhancers, anti-fatigue, antioxidant, aphrodisiac, and anti-aging. The three first one are the most important ones. I mean, the effect of adaptogens on the mental status is very important on, for example, in reducing fatigue. It's very important. Also, the antioxidation property is very important. So also some of them are aphrodisiac, and they can have anti-aging characteristics because they somehow keep organism, they actually maintain organism safety during stress. It can be rather cellular stress or organismal. So we all have heard a lot about saffron, about different characteristics, but there are three specific characteristics which are connected to adaptogenic properties, which are written in Persian medicine manuscripts. One of them is Mofarah, which is mentioned in Mahsan al-Adwiya, that saffron is a very strong Mofarah, which means mood enhancer. And somehow it can bring happiness, for example. It can level up the mental status. The other one is Moravi, which means somehow tonic, and it's saffron is a actually strong tonic of vital organs like brain, also cardiovascular system, and also gastrointestinal system. So it's somehow protecting the vital organs and therefore the organism. Another one is Mubahi, which is somehow, it has the close meaning to aphrodisiac. So saffron is a whole package, and it can be introduced as an adaptogen. So just to compare the Persian medicine characteristic, which was dedicated to saffron, and also the characteristics of an adaptogen. As we talked about it, it can be Mofarah, which can be equal to mood enhancement and also anti-fatigue. It is tonifying the whole vital organs and the whole organism. It is aphrodisiac, and it's also a term which is called مقوی جوهر حیوانی, which is actually somehow it can be related to anti-aging, because in Persian medicine, we know that this is something, there is a kind of a heat, I can say, or hararat gharizi, which keeps an organism alive, and it is somehow connected to cardiovascular system and how to make it, how to maintain its health. So this is another characteristic that maybe makes saffron a good candidate for being actually being chosen as an adaptogen. And also there are some published there are some publications that they're trying to examine adaptogenic specific adaptogenic properties of saffron. And so the reason why I'm actually focusing on adaptogens is that for keeping a person alive, according to lifestyle medicine, one of the pillars is just to stay away from some toxic substances like alcohol and, for example, different smokes. But maybe something else can be added, and it's using certain substances like saffron that can actually maintain the body, the health of the body, and it can keep the mind and body and also emotions safe and sound, for sure. So this concept of adaptogen actually started with ginseng, which was local to the eastern part of Asia, but it's very, very expensive. Although saffron is also expensive, but it's a regional herb in Iran, and because it is used in low doses, I think it can be affordable for people to use it on a daily basis, as people in, for example, Khorasan, people use it in culinary as a spice, or they use it in different beverage. Maybe they can use it with tea and coffee. So they use it and they somehow try to keep their mood up. So what we should know is that emotional well-being is not the highest goal in life, but it is the fundamental requirement. So we need to pay attention to it. Thank you all for listening to my presentation, and thanks for your attention. I would be more than glad if you could stay connected via LinkedIn and my email. Thank you. So thank you everybody for joining this session and also this symposium. For the final speech, I want to invite Dr. Bahram Soltani to give her closing speech.
So thank you everyone for being with us during this more than 4-hour program, which is going to be now finished. I do not want to take your So we want to announce the topic of our next symposium. So this first international symposium on Materia Medica, as I mentioned, is the first part of a seasonal program. So our topic was saffron, and for about 1 month and a half, we were accepting abstracts. During this program, we were honored to have co-organizers from different parts of the world. The program was originally actually organized by School of Persian Medicine, Tehran University of Medical Sciences, but we had several co-organizers, including Süleyman Demirel University of Turkey, World Unani Foundation from India, Maidul University of Thailand, and also some Iranian counterparts, including Persian and Complementary Medicine um, Student Association, Medical Council of the Islamic Republic of Iran, Persian and Complementary Medicine Secretariat, and also a praise to raise team from the Deputy of International Affairs at Tehran University of Medical Sciences. I would like to thank all their co-organizers, and for the next seasons, we will be open to actually other new co-organizers. We're not limited in this regard. We will be happy to have further collaborations with international institutes. So in this symposium, as you saw, we had 10 keynote speakers from 5 countries. We received more than 50 abstracts, half of which were accepted as oral presentations or electronic poster presentations. E-posters will be available as MP4 files on the webpage of Symposium. We're still receiving the files of the participants, those who had accepted abstracts in the form of e-posters. We will also have an abstract booklet, which would be we'll announce the exact date in a few days. It will be probably the 24th of October, but the exact date and time of the symposium will be announced soon. So please keep in touch with us, and please keep your works. If you have worked on damask rose, we will also accept if you have worked on other species of the roses. So it is not just the damask rose, but the main focus would be Rosa ex Damascena. So with this slide and with this poster, I would like to officially finish the symposium. It was a great pleasure for us to have you all, you dear participants in our program. One more time, I appreciate your patience, your interest for joining us today, and I hope I see you all in our next symposium and other future programs of School of Persian Medicine, Tehran University of Medical Sciences. Thank you very much and have a nice day.